involve public health, safety, and quality of life. Rural town councils and residents must be guaranteed a seat at the table during discussion of cannabis regulation, since our rural residential neighborhoods are in agriculturally zoned areas. They will be at the epicenter of any legalization of outdoor growing of cannabis, as well as any predictable spillover of illegal grows, much like what is happening here now, and across California and counties that have legalized growing. Other California counties have been unsuccessful in preventing illegal growing operations. It's obvious that licensing and regulatory fees are either not adequate or diverted away from funding law enforcement for commercial growing operations, legal or otherwise. I suggest that we are very careful when we move forward with regulating illegal or commercial and commercial businesses and growing operations, because no one has been able to contain those, and cartels are not going to ask permission. Thank you very much.
Thank you. Next speaker, please.
Thank you. As a reminder to address the board, if you have not already done so, please press 1, then 0 at this time. Now press 1 and 0 a second time, or you'll be removed from the queue. Our next speaker is going to come from the line of Kimberly Morales. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
My name is Kimberly Morales Johnson, and on behalf of the Gabrielino Tonga San Gabriel Band of Mission Indians, we're speaking about item number 16. We are in support of and grateful for the apology from the Los Angeles County Board of Supervisors for the atrocities that have happened to our ancestors and for the harm that continues today. This is an important step in healing our relationship with the city and county of our ancestral land, Yagna. We look forward to working together around concrete actions the city and county can take to repair historic and contemporary harms, including the return of our land and any other ways to secure and protect our relationship with our ancestral homelands. Thank you.
May we have the next speaker, please?
Our next speaker will come from the line of Marcia McLean. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Yes, good morning. I'm speaking regarding item 23 and public comment. I'm Marcia McLean, Councilwoman, City of Santa Clarita. I am asking that item 23 be continued. I want you to know that in Santa Clarita, we care very deeply about caring for our youth both before and after they may have committed wrongdoing. We welcomed Camp Scudder and Scott when they were probation camps used to rehabilitate our youth. However, due to the topography making these facilities secure enough for both the incarcerated and the surrounding community, it would be cost prohibitive and extremely difficult. Regarding your agenda item number 23, your item number 3, appropriate renovations are called for, and I'd like to know according to whom. There has been no collaboration at all with the city and the surrounding community that make up with the families and the schools surrounding the camp. And I'm hoping that that would take place. Regarding item number 4 on your motion, secure a safer, more therapeutic environment at secure youth treatment facilities. As I said, the topography does not allow for securing these camps without extensive building, and there has been no collaboration out here. I don't know if any of your staff have come out. I've had the pleasure of working with most of you and all of you on the League of California Cities, and transparency and collaboration has always been in the forefront of any dealings that our city has ever had with you. However, in this item, that has not occurred. And if this item does go forward within the next days or so, we absolutely need to have collaboration out here. Camp Scott and Scudder are not secure. They don't have the facilities that you're looking for in order to provide care and rehabilitation for the inmates that would be held there.
Excuse me, your time has expired. May we have the next speaker,
Thank
please?
you.
Next speaker is going to come from the line of Araya Montez Rodriguez. please state the regular agenda items you are addressing today and whether you will address on general public comment. You may begin.
I'd like to speak on item 24 and public comment. Good morning. My name is Aurea Montes Rodriguez. I'm Executive Vice President at Community Coalition, a social justice organization based in South LA. We're here today with Advancement Project California, Inner City Struggle, SEIU 2015, and over 40 organizations to applaud and support Supervisors Mitchell and Barger for introducing agenda item 24, Recovering Better Than Before, which is calling on the CEO to create an equity index for the American Rescue Plan Act funding. The COVID pandemic exposed decades of disinvestment and structural racism that devastated high-need communities throughout the county, especially communities like South LA. President Biden emphasized that the American Rescue Plan dollars are intended to help us build back better, creating an opportunity to center equity and move us away from status quo budgeting that historically has left families behind solely based on the zip codes that they live in. Families that we work with at Community Coalition are hurting. They're facing dire situations because many of them are essential workers, live in homes with multi-generational family members or in high-density situations, or they're struggling with food and housing insecurity. Today, the board has an opportunity to act decisively in centering highest need communities. We call on you to use the $1.9 billion in ARPA funding to restore our communities and support families to get back on their feet so they can receive critical supports, including food aid, rent relief, small business loans, shelter and reentry beds, and also internet-enabled devices. The motion also calls for public transparency, which we fully support. Supervisor Solis, Han, and Kuehl, please vote in support of this motion so we can get a unanimous vote for an equity formula to guide the ARPA spending and support the county's most vulnerable residents. Thank you very much.
Thank you. Next speaker, please.
Next speaker will come from item Nicole Brown. Please state the regular agenda items you're addressing today and whether you will address it on general public comment. You may begin.
Good morning. I would like to comment in support of agenda items 15, 21, 23, 33, and general public comment. And I also want to provide, I'd also like to provide support or express support for items 15 and 24, among others. Good morning. My name is Nicole Brown with the Urban Peace Institute and LA's Uprising Coalition. On agenda items 15 and 21, thank you to Supervisors Solis, Han, Mitchell, and Barger for putting forth these two important motions and investing in violence intervention. These motions bring vital investments into areas of the county that need it most. Gang and violence intervention is a community-led safety strategy which has proven extremely effective at preventing and reducing violence, and these motions will undoubtedly bring peace and relief to communities in the county. These are important first steps towards building a countywide infrastructure for violence prevention and intervention, and we encourage even further investment to increase wages, build a workforce, and provide wraparound services for communities most impacted by violence. We hope you will continue to invest in these strategies through the American Rescue Plan and other ongoing funding streams. On agenda item 23, the DJJ transition plan, we strongly support this motion. We must support LA County youth who would otherwise have gone to DJJ through strategies rooted in Youth Justice Reimagined. To the councilwoman from Santa Clarita, I want to clarify, this is about providing care and rehabilitation for our youth. Rather than send LA County young people to horrible state facilities, we have the opportunity to provide them with support and rehabilitation they deserve here at home so they are not further traumatized by the system and can successfully transition back into the community and adulthood. Ensuring programming, reentry services, and a mixed staffing model are essential. The DJJ transition is our opportunity to begin implementing Youth Justice Reimagined rather than perpetuate more trauma by holding young people in the compound, which is the plan that the probation department originally sent to the state. Lastly, on agenda item 33, moving forward with Youth Justice Reimagined, we support this motion as this series of report backs will bring much needed transparency from various county departments. We hope the board will show its ongoing commitment to Youth Justice Reimagined by fully funding the initiative in the supplemental budget. While $17.3 million additional dollars to YDD is a good thing, we need more funding to community-based organizations to build a network of youth development and fund other parts of phase one of the plan, such as school-based supports, reentry, and peace builders. In this motion, we thank you for mandating a plan to end the ineffective and harmful citation diversion program. This plan must include amnesty for all current DMV holds and pending tickets, as hundreds of young people are unable to drive and owe large sums of money for low-level status offenses. Let's live our values, end citation diversion, and fully fund Youth Justice Reimagined. Thank you very much. I yield my time.
Thank you. May we have the next speaker, please?
The next speaker is going to come from the line of Rudy Ortega. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Good morning, Chair and Board of Supervisors. My name is Rudy Ortega, Jr. I'm the tribal president of the Fernandino Tatavian Band of Mission Indians, and I'm speaking on behalf of item 16 in my tribe and provide public comment as well. I just want to thank the Board of Supervisors, especially Supervisors Solis and Hahn, for bringing such a motion to recognize the acknowledgement in the conditions that the tribes have been treated with here in Los Angeles County, and to do the study to further enhance the relationship between the tribes and the county. So I'm in favor of item 16, and again, I thank you all for bringing this forward for discussion and approval, and looking forward to working with the county supervisors. Thank you.
Thank you. May we have the next speaker, please?
As a reminder, to address the board, if you have not already done so, please press 1, then 0 at this time. Do not press 1 and 0 a second time, or you will be removed from the queue. Next speaker will be Betty Avila. Please state the regular agenda items you are addressing today and whether you will address on general public comment. You may begin.
Good morning, Board of Supervisors. I'm calling to speak about item 78D and general comment. I want to express my support of Supervisor Solis's motion to have some sort of reparations given to the women who have experienced forced sterilization in Los Angeles County. This would set an incredible precedent about, just the way that our own local government views this trauma that these women experience, and I think is really going to be both healing but also empowering for other women in our community. I also think, it's incredible to know that this is happening at a statewide level, but I think it is important for our local Board of Supervisors to be behind this, to support the women, and I think really to support, women's bodily autonomy on a very broad level. So this is an incredible precedent, and I hope that you do move forward and pass this motion. And thank you, Supervisor Solis, for your leadership on this issue. Thank you.
Thank you. May we have the next speaker, please?
Next, we'll go to the line of Genevieve Clavia. Please state the regular agenda items you're addressing today and whether you will address on general public comment. You may begin.
Yes, good morning. This is Dr. Genevieve Clavia. I will speak to item 27 and 12. On item 27, I cannot believe the original version of that item. What's so great is somebody got to their senses and had a revised statement. This revised statement makes much more sense. At least he's not pushing down our throat that so-called a new concept from Pat Brown Institute and so on, was all about the money, not about not about the homeless. Please have some public hearing on that subject. You need to be dealt with the public having input on what's going on with the homeless. It's about time you do that. And please reopen the board so people can come in person and deal with those issues. Have a good day and a good week. I hope the next time.
Thank you. May we have the next speaker, please?
Yes, next we'll go to the line of Emily North. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Hi, my name is Emily. I'm calling for agenda items 2, 15, 16, 21, 23, 29, 32, 33, 34, and 78C. On item 24, I would like to urge the members of the board to vote in favor of implementing an equity formula to allocate COVID relief funds. Since the pandemic began, people of color and low-income communities bore the brunt of the pandemic as they faced disproportionately high rates of infection, hospitalization, and communities were hardest hit by the virus due to historical disinvestment and discrimination. But thanks to the LA County has the opportunity to address these inequities that were exacerbated by the pandemic and help these communities recover by focusing on communities with a higher need for support. As LA County is expected to receive $1.9 billion in federal funds, the county has a responsibility to allow anti-racist principles to drive allocation of these resources to ensure that all of these resources are distributed equitably, as the pandemic obviously has not affected all of LA's communities equally. Allocating these resources according to an equity formula could help fund programs like community-based pretrial services systems, which would lessen the financial burden that pretrial release places on Black, Latinx, and low-income communities. I ask that the board support items 4 to ensure that the aid and resources are going to communities that need it most. Thank you. I yield my time.
Thank you. Next speaker, please.
Next, we'll go to the line of Elizabeth Andrew. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin. Elizabeth Andrew, your line is open.
Hello, Elizabeth, please begin.
Hello, can you hear
Hi,
me?
yes, please begin.
Hi, I am going to be speaking on agenda items 2, 10, 15, and 21. My name is Elizabeth Andrew. I am a resident of Lake Los Angeles in the Antelope Valley, and I am also a member of our town council. The cannabis grows are horrendous. Our children can't go outside and play. They can't go out into the desert and ride their bikes or anything because they are being confronted by armed people. You can smell things in the air. It's not good for our seniors in our community, and we have a lot of those. We are for lack of a better term, a underprivileged area. We don't have a lot of help out here, and to take away the sheriff's department would be unconscionable. We appreciate all of our sheriffs and what they do. We appreciate Sheriff Villanueva for his endeavors to eradicate the cannabis growth and all the other agencies that have helped, but we need more help. Our desert floors are just littered with everything. Chemicals are going into the dirt, into the water table, and they're stealing water to water marijuana plants. And the thing that bothers me with that the most is if we run out of water here, it will affect everyone, including those in the cities. I would appreciate it if the other supervisors would back our Supervisor Barker on her motions. Thank you.
Thank you. Next speaker, please.
Next, we'll go to the line of Barbara Prindle. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Good morning. I'm calling in regards to item number 23. I have already left each of the members a personal email letting them know that they should vote no on this matter. I am a 28-year resident of Saugus, and I live very close to your proposed plan of making Camp Scott and Scudder a long-term facility for serious offenders. This facility is within 600 feet of existing homes, and this is not a remote location to place these offenders. Just curious how many of you would vote yes for this if it was in your backyard. Saugus is a family community. It's not a place for serious juvenile offenders. Along with the juveniles come family, friends, traffic, a higher crime rate for Saugus, drugs, theft, etc. Based on a yes vote, you would be forcing the residents of being afraid of becoming a victim of a crime themselves. and I would no longer feel safe to allow my children or my grandchildren to go outside and play. I have heard from lots of other people and at the Santa Clarita City Council meeting.
Excuse me, your time has expired. May we have the next speaker, please?
Next, we'll go to the line of Jeffrey Hillinger. Please state the regular agenda items you're addressing today and whether you will address on general public comment. You may begin.
Yes, this would be in regard to the agenda items 2 and 10 and also public comment. My name is Jeffrey Hillinger. I'm the Vice President of Little Rock Town Council. I'm also the Assistant Director of the ARTC. One of the things, obviously, you've heard from Susan and a couple of our other community members in regard to what's going on up here. I would think that when you are looking at amending some of these items, that also you take a look at what code enforcement could possibly be doing in order to nip things in the bud before these grows get started. One of these things would be in construction of these high tunnels. They are over 7 feet tall. For any type of high tunnel in the Antelope Valley, you need to permit for anything over 7 feet tall when it comes to a high tunnel. Also, these high tunnels are very close together, which makes a problem if something catches on fire. When these people are clearing and lowering, where they actually submerge these grow areas, they are leveling the land, and they're probably easily taking over 18 inches of topsoil, which you would also need a permit for. At the same time, when they're clearing these properties, they're killing our protected Joshua trees and other indigenous plant life. I would think that, just with a few of these things in mind, that you could literally stop these people from even starting these grows just from the normal codes that are already in place. Also, in regard to any future permitted cultivation, I would think that you would want to do it indoors and in a commercial industrial buildings, not in a residential areas or outdoors, which, I mean, it's just, we're loaded with them out here. I've got 4 grows across the street from my place. They've literally closed down S8, which is a dirt road that goes out there, so people can't even ride their horses. In fact, my neighbor had to move their horses to a stable that had a riding area in order to even enjoy their animals, which they've got plenty of property right here to where they could be keeping those horses, but instead, because they could no longer go out into that field, they had to go and find a place to put their horses. So anyway, it's just ridiculous out here. I would urge the rest of the Board of Supervisors to come out here, maybe get in a helicopter, take a flight, take a look at what's going on with our desert out here and all these grows. Anyway, thank you very much for your time. I appreciate it.
Thank you. May we have the next speaker, please?
As a reminder, to address the board, if you have not already done so, please press 1, then 0 at this time. Do not press 1 and 0 a second time, or you will be removed from the queue.
We will now hear the Spanish interpretation of this reminder.
Como recordatorio, para dirigirse a las supervisoras, si aún no lo ha hecho, presione 1 y luego 0 en este momento. No presione 1 y 0 por segunda vez o será eliminado de la fila. Gracias.
Thank you. May we have the next speaker, please?
Our next participant will be Marna Romero. Please state the regular agenda items you're addressing today and whether you will address on general public comment. You may begin.
Hi, good morning. My name is Marna Romero, and I'm with Soledad Enrichment Action, and I am speaking on board motion item number 15. And we are a gang intervention and gang prevention agency that provides services in LA County. In addition to these services, we provide youth diversion, youth and adult reentry, as well as counseling and tattoo removal. We want to thank Supervisor Solis for authorizing the motion and Supervisor Hahn for co-authoring. SAIA does work in this area, and we work with the Office of Violence Prevention, And this funding would be very important to allow us to continue the work that we do in the Los Angeles County area. And if OVP is funded through this motion, it would allow organizations such as ourselves to continue to do this work and to better serve the needs of the community that we serve. Again, I urge the board members to vote in support of Supervisor Social Police. Thank you.
Thank you. Next speaker, please.
Next we'll go to the line of Ezekiel Nashiyama. Please state the regular agenda items you're addressing today and whether you will address on general public comment. You may begin.
Hello, can you hear me?
Yes, we can. Please begin.
Hello, my name is Ezekiel Nishiyama. I'm with the Anti-Racism Coalition. I'm here today to speak on both items 23 and 33 and general public comment. As a young person, I experienced both LA County Juvenile Halls and the California Division of Juvenile Justice. When I think that DJJ was getting closed down, I was happy to know that young people wouldn't have to be in the same facilities I experienced. I knew that with the closure of Division of Juvenile Justice, we would have to create a better system that serves and supports our young people. I looked forward to what LA County would create in hopes that we would not make the same mistakes and create the same system that we know is broken. No young person is born bad. All young people make mistakes, and that is why we collectively need to support their growth. You don't become a serious juvenile offender until you're treated like one. We all start up in the same place, and that is our community, what we are surrounded by. Most of us come from community, but we don't have the first chance. The culture of DJJ specifically contributes to this narrative that these young population people are violent and dangerous. These young people need the services and the opportunities that are going to navigate them out of the juvenile justice system. Young people are going to be released and be a part of our community, so it's very important that we focus on how we are going to support these young people in a way where they aren't being trapped in the cycle of incarceration. Support their reentry. We need jobs, education, housing, and most of all, the support from our own community. As a young person who was incarcerated, I was able to reach a fire camp facility where I was able to be centered in the community and take on new skills. I participated in a hand crew where I put in many long hours to fight the California wildfires all across the state. Give young people a job, give young people the support they need to come home and have a successful reentry. This is how you create real public safety, giving young people the opportunity to give back to the community they have done harm to. Look past the narrative and don't judge these young people by their worst mistake. Some of these young people just never had a role model to look up to and the right support for them. The connection to CBOs is so important in providing that support. We need to be lifting up Youth Justice Reimagined as a whole to be a role model across the state. When we push young people away, what resources are available? Treat our young people as if they were your own. Support their rehabilitation and give them the food they need to grow, because ultimately that will result in less crime and recidivism. Thank you.
Thank you. Next speaker, please.
Next speaker will come from the line of Roy Humphreys. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Okay, I'm Roy Humphreys, the Rolling Heights Advocate, and I'll be speaking on items 32 and the multitude on the cannabis situation. On item 32, my name is spelled with an S on the end. As to the cannabis situation, something that I have heard no one talk about, and it's called pate comitada. Okay, you want to take care of help with the law enforcement, and obviously you should have multiple assets from federal DEA, etc. That should be taken care of. Also, the board has continued to fail us all by not initiating proposal, now this is public comment, from removal of the jails from the Sheriff's Department via California Penal Code Amendment, and Philip Chen, Assemblyman, and Josh Newman, State Senate, are waiting for your call. The Gang of Four, with its sanctuary socialist cultural agenda, has destroyed the county, the state, and the country. The governor of California, with California values, will be replaced, and with Gascon to follow, given the possibility to reclaim California and put America first. So that we're promoting Supervisor Catherine Barger for governor. And Supervisor Hahn, I'm asking you to put Rowland Heights on the ballot once again for cityhood. We can get that situation resolved. And also the supervisors, Molina, Ridley Thomas, Yaroslavsky, Kanabi, and Tanovich should have gone to federal prison along with Tanaka and Baca for under the gang operations supporting laws that applied at the time. And we have one more. I think I'll just leave that there for today. Thank you very much.
Thank you. Next speaker, please.
Next speaker will come from the line of Janice Weiss. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Thank you. My name is Janice Wise. I am the president of the Juniper Hills Town Council. Juniper Hills is in the unincorporated northeast area of Los Angeles County in the Antelope Valley. And we've been experiencing, as you've heard from several other speakers, an increase. Oh, I'm speaking in favor of item number 2 and item number 10, sorry. So we too have experienced the increase in the illegal cannabis grows in our neighborhood. Our community, as you know, was devastated by the Bobcat fire back in September. We lost close to 80 homes in that fire. It's been a tough time in reality for our community, and our community is vulnerable and at risk at this time. Just trying to get through the red tape of the rebuilding, some people are just kind of giving up and selling, and we are just ripe for these cartels to come in and sweep up these properties and these homes at this time. And as we're seeing this increase come in, we are also deeply concerned about our water source. We rely solely on groundwater and wells. Up in Juniper Hills, we don't have a public water system. These illegal grows, as you've already heard, are putting toxins into the ground. It's a real danger for our groundwater, not to mention the water stealing that you've already heard about. The water table in the Antelope Valley is at risk, and if that happens, our communities are also at risk, and we don't want to just survive out here, but we want to thrive. We're just devastated about the amount of toxins and the illegal dumping that goes along with all of this cannabis grow in the Antelope Valley. So I would encourage and strongly support all of you to please vote in favor of items number 2 and items number 10 on the agenda today. Thank you.
Thank you. Next speaker, please.
As a reminder, to address the board, if you have not already done so, please press 1 then 0 at this time. Do not press 1 and 0 a second time or you'll be removed from the queue. Our next speaker will come from the line of Guy Randles. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Yes, good morning. I will be addressing items 2 and 10 and public comment. My name is Guy Randles, and thank you to the Board of Supervisors. I am a board member of the Green Valley Town Council and also a member of the Association of Rural Town Councils. Thank you for the opportunity to speak on this issue of illegal cannabis grows, water theft, and public safety. This is not the Wild West. Our tax-paying citizens should be safe in the 5th District and not be intimidated by cartel thugs. Our groundwater is being contaminated by grow chemicals. Our water systems are being compromised by theft. Our land is being decimated along with the protected Joshua trees. This is an unfolding disaster, and it's very serious. Make the AV safe. Fund the sheriff. Amend your laws.
Thank you. May we have the next speaker, please?
Our next speaker is going to come from the line of Barbara Capos. Please state the regular agenda items you'll be addressing today and whether or not you'll address a public comment. You may begin.
Good morning. Barbara Capos, Executive Director with the East Los Angeles Women's Center, calling on item 78D and general public comment. The East Los Angeles Women's Center has served the greater East Los Angeles for 45 years as a leading voice and advocate for Latino survivors who have endured gender-based violence. I want to thank Supervisor Solis for this motion and for promoting human dignity and justice. I am in support of this motion and bringing justice to over 200 women who were impacted by this traumatic occurrence in Los Angeles County. These women and their families deserve restoration. And although we applaud the efforts of the state to provide reparations to women who experienced forced sterilizations that resulted from state law, the scope of the reparations is limited to state-sponsored facilities and does not include the survivors who were at LAC-USC Medical Center. Here in Los Angeles County, the Latino women, many who were immigrants, experienced these human rights violations and must be remembered and paid reparations. Moving forward, in addition to the reparations, it's important to reflect on these inequities and protect the reproductive rights of all women. Thank you.
Thank you. Next speaker, please.
Next speaker will come from the line of Christopher Manzal. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Hello, I'll be addressing items number 10 and number 2 and public comment. Hello, my name is Christopher Ivan Menzel, and I'm from the Pear Blossom Rural Town Council, but I'm also speaking as a father and a lifelong resident of North Los Angeles County. I've witnessed a great disturbance in my community. I don't need to tell you, any of you, that crime is also a very big issue. Never in my life I've ever seen lawlessness like I've witnessed over the last year, with people doing whatever they want because they all know there's only one, maybe two sheriffs at any given time covering the area the size of the San Fernando Valley. It's easy to hide, threaten people, take over a town, ruin quality of life for its residents. Our little desert is one of Los Angeles County's gems, and it is being destroyed due to lack of well-regulated plan. The demand is there, and now it's time to start thinking about regulations in a regulated industry in which my community supports. With a regulated industry, funds for law enforcement would be available through tax dollars, which are currently being, which are sucked up by the black market. Please don't allow my daughters to grow up in a third world-like conditions. We are tired of living in fear of repercussions for profit of the black market and forced to live without compensation. It's very upsetting, so let's get on it and protect the people of Pear Blossom and surrounding communities. I've watched the unregulated market take over our communities, and the demand is there, so let's get a comprehensive regulations for North County. This is the only way that we can do this. We have a wonderful tool at your disposal called Community Standards Districts. We've established borders, councils, and communities should be able to decide if they would like to keep the ban in place within their boundaries or allow regulated commercial industry to enter it. These communities know their land. They know their community's limits and should have the right to allow or deny industry in their area. A regulated market will not only provide more law enforcement to help curb illegal activities, but also provide additional safety measures for the community. My town supports a regulated plan, so we would like to feel safe here and there's a perfect way to accomplish that. I encourage you to directly engage with the town councils as they put in hundreds, if not thousands, of volunteer hours to help keep their communities the way they know fits best. Los Angeles County is very big, and there's not one solid plan that will work. You will need to have different plans for different parts of the county. This will be the only way to accomplish this. So let's include communities at a very local level and keep the money at a local level. Any additional money that comes through this should be by way of permit fees and no new taxes implemented, as the industry is already
Excuse me, your time has
overtaxed.
expired. May we have the next speaker, please?
Next speaker will come from the line of Matthew Garland. Please state the regular agenda items you'll be addressing today and whether you'll address on general public comment. You may begin.
Good morning. My name is Matt Garland. I'm going to speak on item number 2, no general public comment.
Please begin. You have 2 minutes.
Okay. I'd like to thank Supervisors Solis and Supervisors Hahn for bringing the motion forward. I'm speaking in support of the motion. Regulation of cannabis is the best way for communities to move forward with real public safety. The timing is right for LA County to move this industry out of the illicit market and into a regulated one. I thank you for your time, and I yield the rest of my time. Thank you.
Thank you. Next speaker, please.
As a reminder to address the board, if you have not already done so, please press 1 then 0 at this time. Do not press 1 and 0 a second time or you'll be removed from the queue. Our next speaker will come from the line of Malahat Rape. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Good morning. I'm calling on agenda number 2 and no general comments. I'm a member of the Cannabis Advisory Working Group who worked on 64 recommendations for regulating cannabis and provided them to the county. Thank you to Supervisor Hahn and Supervisor Solis for your motion today, which asks the county to revisit the recommendations that we all worked so hard on in 2017. Honored to be as Supervisor Hahn's appointee, I collaborate among stakeholders with many combined years of experience working with youth, working in education, and working in the cannabis industry. I am proud to say that we were able to reach consensus on matters related to protecting the public health, youth exposure to cannabis, consumer protections, and much more. We can achieve how to work together in this environment if we work together and build it on consensus. I believe now is a good time to try and move forward to implement these recommendations, and I believe we can be successful if we use common sense approaches and strategies, much of which we worked on for many weeks and months in 20. This work and to work in LA County. Thank you once again to County Supervisor Janet Hahn for your motion.
Thank you. May we have the next speaker, please?
Next speaker will come from the line of Leanne Lehman. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Items 2 and 10. Good morning, Honorable Board of Supervisors. My name is Lynn Lyman, resident of Van Nuys, District 3. I want to thank Supervisors Hahn and Solis for seeking to move the county towards legal regulated cannabis through their Item 2 motion. I was co-author and co-chair of Proposition 64, the Adult Use of Marijuana Act, and I served on the County Advisory Working Group and developed the 64 recommendations in the reference report. We debated, deliberated, and tried to reach consensus on the many complex issues encompassed in ending over 80 years of cannabis prohibition. While I support the vast majority of the recommendations in the report, I believe it should be updated to reflect current learning. I'm especially proud of Recommendation 64 that called for establishing a social equity oversight committee and other equity recommendations requiring local higher thresholds, community benefit agreements, and developing a pathway to legalization for existing county operators. The recs also include guidance around revenue allocation as an opportunity for real community reinvestment. It is important to not replicate the mistake the city of LA made with all their cannabis revenue going to the general fund, thereby primarily increasing police budgets rather than repair for the harms of the war on drugs. I would also like to speak in opposition to Item 10, the Barger-Kuehl motion on how to deal with unlicensed cannabis grows. While I share concerns around water and local resource abuses, it doesn't make sense to request the order on enforcement in 90 days and yet receive the full plan for regulating and lifting the ban in 120 days. You should give time for regulating and licensing to work before drafting more ways to criminalize Angelenos. Use normal codes already in place, as a previous speaker advised. And the sheriff has a $36 billion budget and really doesn't need another $250,000 to bust cannabis operators. Additionally, I strongly oppose directing county agencies to cooperate with the DEA and other despised federal agencies. It will only sow distrust and antagonism between local officials and the cannabis community. Nearly 60% of LA County voters cast a yes vote for Prop 64, and yet 5 years later, the county remains entrenched in full prohibition.
Excuse me, your time has expired. May we have the next speaker, please?
Next speaker will come from the line of Eric Previn. Please state the regular agenda items you're addressing today and whether you'll address on general public comment. You may begin.
Yes, I will address on general public comment, and I'll speak on several of the items. We could start with item 40. You know, your agenda today has 96 items, but item 40 alone is a bunch of minor leases where you're giving away, you know, people don't have to pay rent and pay less or pay less than $10,000 a month in rent. It's over $12 million in rent. But, and there's, if you can believe it, I believe that there's something like 59 gratis leases and over 101 individual leases, one of which I looked at, one of the 101 was for American Golf Corporation, and we a couple of years ago had Sachi Hamai reverse it because it was outrageous that a corporation on Wall Street was paying rent. We were paying them rent. It was just horrible. So you got too much on this agenda, and it's really destructive. You've got acquisitions of a $547,000 debris boat. The only problem is we're getting rid of 2 other boats, but how? And what is a debris boat? We're not even quite clear about that. Item 27, the LASA item, is astonishing. You've got it wedged in here where maximum a person could speak for a minute or two. The entire city and state are focusing on this problem of how have the County Board of Supervisors and the city ensnared one another in an absolutely ineffective, it's like a transmission that is seized. And we just keep pouring money after money after money into the engine, but it's not running. More and more people are homeless, and we need help. But we don't need Rafe Sonnenschein identifying that it's the he's been there for a very long time working together hand in hand. What we do need is transparency, and we need real public meetings. As I look at this agenda, there are so many important things. The indigenous folks who spoke, when people speak up, it's important for the public to hear it. But when they can't speak up, because the Board of Supervisors has adopted a weird policy of 1 hour per fortnight, it's just insulting, Sheila. You have to get it together. You have to start opening the doors to regular meetings. You have to. The Strobel appeal is buried on this agenda. The county board is now going to appeal the Measure J ruling against the county. There's also on here an item on March 29th, 2021, the LA Superior Court granted a writ of mandate and issued a judgment in favor of something called Save Our Rural Town against the County of Los Angeles. And yet this is all being washed by without any comment as people line up to sort of cheer you on for the things that you're trying on, but not effectively. Also, item 36, this is critical, because in the past you've buried important policies inside what is called the board established priorities. That has not even been published this time, so we can't understand what you're changing and how you're changing it. It's bad. You've got multiple items about violence and violence interruption, partner violence, intimate partner violence. You've got funding about $5 million floating around, but you don't specify to whom you want to give the money. If you want to give it to Peace Over Violence, you should make that overt. Jim Newton had the tag of Aline Chickbedian's piece about the sheriff, who is a complicated guy who's playing both sides of the coin. But he pointed out that if there's not a credible...
Excuse me, your time has expired.
It doesn't
Madam
matter.
Chair, that concludes the 1 hour of public comment testimony.
Thank you very much. I appreciate everyone who has indicated their comments during this past hour. And please keep in mind that if you weren't able to provide your comments, that you could submit written comments also as indicated on our agenda. And we'll continue to accept all those written comments that come in during the meeting, which will become part of the official record. So I thank all of you for addressing the board. Thank you very much. Moving on now, Madam Executive Officer, please indicate the agenda item numbers on which we will be voting.
The following items are before you. Items 1D through 4D, 1P, 1, 4, 6 through 9, 11 through 13, 17 through 20, 22, 25 and 26, 28, 30 and 31, 32 as revised, 33 as revised, 34 and 35, 38 through 57, 59 through 77, 78A and 78B, 78C, Supervisor Barger request to be recorded as abstained, 78E and 78F, 81 through 85.
Thank you. These items will be moved by Supervisor Hahn and seconded by Supervisor Kuehl to approve these items. Madam Executive Officer, please call the roll.
Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you, members. Now I'll go over the meeting order for today's agenda. Today we'll begin with the set item S1, followed by items 2 and 10, which will be taken up together, and then items 3, 5, 14, 16, then items 15 and 21, which will be taken up together, followed by items 24, 27, 29, 37, and finishing with item 78D. With that, members, we'll turn now to the set matter, item S1, public health order. And this is the opportunity for the board to discuss the closures and the pandemic trends as we see them on a weekly basis. I'd like to ask Dr. Davis and Dr. Galley if they can please provide their updates accordingly. Thank you. Dr. Davis.
Thank you, and good morning, Supervisor Solis, and to the entire Board of Supervisors. As always, I'd like to express Dr. Ferrer's and our department's sincere gratitude for your support and continued leadership. Thanks for the opportunity to present to you and the public the latest on the status of the ongoing COVID-19 pandemic here in LA County. I understand that your board agenda is pretty packed, and I'll shorten my comments as much as possible. But as a top-line message, our COVID-19 metrics have continued to increase over the last week. And then we can move to the next slide, please. So I'll go through and provide some updates in terms of the case numbers, as well as vaccination rates, and then some recommendations as we get to the end. So we're sad to report an additional 12 deaths today, all of people who died had underlying health conditions, which brings our total deaths to 24,554 in Los Angeles County. We share our deepest condolences with those of you who have lost friends, loved ones, and family during this difficult time. We're also reporting 1,103 new cases today, a 165% increase over the last week, which brings the total number of cases in LA County to 1,259,772. Currently, there are 376 people currently hospitalized with COVID-19, and there are currently 48 open investigations at residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. To date, we've had more than 7 million people have been tested and had results reported in LA County, and our daily test positivity, and this is an update from the slide that was sent last night, was 2.8%. Which is an increase of what we had of less than 1% on June 15th when we did the reopening and lifted physical distancing restrictions as well as capacity limits. Our daily case rate average is now at about 4.8 cases with a week lag, which is also an increase from last week's case rate, which was around 1.74 cases per 100,000. We can go to the next slide, please. I'll now share fairly quickly some graphs related to our age-adjusted case rate, which is a case rate per 100,000, looking at cases, hospitalizations, and deaths by race ethnicity. Since May, late May, cases have been rising across all racial and ethnic groups, but largely among Black residents represented by the green line, followed by white residents and Latinx residents represented by the orange and yellow lines respectively, then by Asian residents represented by the blue line. The case rate for Black residents is now 97 cases per 100,000, and about 39 per 100,000 for white and Latinx residents, and about 17 per 100,000 for Asian residents. Next slide, please. As a reminder, hospitalization rates often lag 2 to 3 weeks behind case rates. As you can see on this slide, we began seeing increases in hospitalization rates in some groups beginning in the second week of June, after cases began to rise during the week of May 31st to June 7th. Again, these rates are highest among Black residents represented by the green line, followed by Latinx residents represented by the yellow line. And among Black residents, we saw about 13 hospitalizations per 100,000 people, and among Latinx residents, we saw 7 per 100,000 people. The hospitalization rates among white and Asian residents, represented by the orange and blue lines, respectively, are lower and appear to be stable at around 3 and 2 per 100,000 people. Next slide, please. Here we see deaths by race and ethnicity. As you can see, the death rates remain low in the wake of these increasing case rates. Again, this metric generally lags even further behind changes in case rates than hospitalizations do, and this number may start to increase over the next couple of months. Next slide, please. This slide is showing our COVID-19 vaccination rates, which to date we have continued to increase vaccinations amongst all groups. But as we look at this, as of July 9th, nearly 10.7 million doses of vaccine in the county, including more than 5.9 million first doses and more than 4.7 million second doses, have been administered. This means that more than 5.7 million LA County residents have 1 dose and more than 5 million are fully vaccinated. Among LA County residents 16 and over, 69% have received 1 dose of vaccine and 61 are fully vaccinated. And among our seniors 65 and over, 88% have received 1 dose of vaccine and 77% are fully vaccinated. I'll take the next slide, please. We thank the millions of residents that have made the decision and have against COVID-19. And we continue to see fewer folks than we'd like to see during getting their first doses of vaccine on a week-to-week basis. And as you can see from the trends represented on this slide, between July 5th and July 9th, we administered 40,836 first doses across the entire county. And unlike the bars representing previous weeks, this number does not include vaccines administered over the weekend, so we expect this number will be higher. However, once those vaccines are added in, we're not likely to reach the 100,000 doses, first doses administered that we'd like to hit each week. Let's take the next slide, please. In general, as I mentioned, more people are getting vaccinated across all groups every day, and we continue to be extraordinarily grateful for all partnerships and the deep commitment on part of so many to support vaccination efforts. And as we look at age subgroups by race and ethnicity on this slide, we continue to see gaps among teens and younger adults that we have seen over the past weeks. And among both the 12 to 15 and the 16 to 17 age groups, between 1/3 and 2/3 as many Black and Latinx teens are getting vaccinated as their American Indian, Alaska Native, white, and Asian counterparts. So the rates are lower, by that factor. I want to note that while we have seen high percentages of vaccination rates among Native Hawaiian Pacific Islander adults, the numbers in this group as listed as vaccinated are overestimated, and percentages of vaccinated are therefore also overestimates. The data does show significant gaps among adults 18 to 29, with 29% of Black adults in this category and 43% of Latinx adults have been vaccinated, compared to 59% of their white and 77% of their Asian counterparts. The disproportionality also persists among our 30 to 49 years old in this group. About half as many Black adults have been vaccinated as their Asian and white counterparts. It's particularly worrisome to see these persistent gaps among young and middle-aged adults who are an important part of our workforce and very much active in our communities. Continuing to provide accurate vaccine information and ensuring vaccines are widely available, and continuing to recommend sensible actions to protect those not vaccinated remain our highest priorities. I'll take the next slide, please. As we look at the comparison rates by race and ethnicity, looking at the comparison for a 2-week period, first ending on June 3rd, alongside the same metrics a month earlier for the 2-week period ending July 3rd, you also see that the percentage of population 16 years and older by race and ethnicity who have received 1 dose through July 9th. Actually, you don't have that slide. When we look at these rates of new cases, we can see that over the month preceding July 3rd, cases began to increase among all racial and ethnic groups, although the highest case rates were observed among Black residents, whose case rate increased from 39 per 100,000 to 97 per 100,000, an increase of 149%. We also saw case rate increase by 81% in Latinx residents, 144% in white residents, and 183 in Asian residents. So no group has been spared in terms of the increase in cases, and we should be mindful of this. Over the same interval, hospitalization rates decreased by 9% among white residents, and these rates have been trending upward by 30 to 55% in Black, white, and Asian residents. And as mentioned, on June 15th, the risk of infection with and severe illness from COVID-19 remains highest among those who are not vaccinated. And we're unfortunately seeing this play out here in our county, across both the state and our nation, and in other countries in the world. When we look at the group with the lowest vaccination, population vaccinated with at least one dose of vaccine, which would be our Black residents, again, we note here that we see the highest case and hospitalization rates. And for the group with the highest percentage of population vaccinated with at least one dose, our Asian group, we see the lowest case and hospitalization rates. And even without the same level of threat to the healthcare system as we experienced during the surge, these rising cases among all groups and the disproportionately higher rates among Black and Latinx residents are both concerning and require continued action to prevent spread and poor outcomes among those who have already suffered the most during this pandemic. It's clear that the threat of COVID-19 is still with us and that we are dealing with a more infection variant that causes it. And the best collective action that each of us can take is to get vaccinated against COVID-19 if you're eligible, and to take sensible precautions if you are not eligible or choose not to be vaccinated. We'll go to the next slide, please. As we see, this is a map that shows where you can get vaccinated, and again, making sure that it's easy for eligible residents to get vaccinated at many different sites in the county is very important in order to make it as easy as possible. As you can see from this map this week, there are 771 sites offering vaccinations, including pharmacies, clinics, community sites, and hospitals. And you can see that many of our sites are, again, concentrated in areas that have been hard hit by the pandemic. And as a reminder, residents can obtain vaccines at most sites, without an appointment. And many of the sites are open on weekends and have evening hours. And again, all of this information is available about the vaccines, and you can search where to find a site, all online at vaccinatelacounty.com. Next slide, please. This map shows by supervisorial district, there are about 165 sites in SD1, 137 in SD2, 177 in SD3, 134 in SD4, and 157 in SD5. Sites on this map, include the clinics, the pharmacies, in addition to the GPH LA City and hospital sites, as well as federal sites, and does not include the mobile sites. And we'll go to that on the next slide, please. We have continued our strategy. Next slide, please. We have continued our strategy for improving access to vaccines, by having mobile vaccination teams take vaccines into the neighborhood, and to neighborhoods where to reach people who have limited ability or time to get vaccinated at one of our sites. And the mobile vaccination teams continue to work with employers and community organizations to provide vaccines and information about them at convenient locations where residents gather. This is a form, there's a form on our website to request a mobile team, and we encourage employers and event organizers to let us know when they want to host a team to provide vaccinations at their site. We have been setting up sites, continue to set up sites at retail stores that will have us, as well as parks, recreation centers, and many other gathering places all over the county, again, to make it easy as possible for residents to get vaccinated. Next slide, please. Next slide, please. I want to make you aware of a pilot that we're rolling out, and one that we've continued in order to get vaccines into the neighborhoods where they're needed most. First, we are piloting a project that in our context has been called a ring or halo vaccination strategy. And the purpose of this project is to vaccinate close contacts of COVID-19 cases. It doesn't prevent them from getting COVID if they were actually infected, but it does protect them in the future if they did not develop the disease. And this happens once they're identified and if they're willing to be vaccinated, as well as offering to vaccinate their contacts as well in order to create a ring of people around them that are fully vaccinated. The way that it works is once the contacts are identified during the case investigation process, a member of our team reaches out to their contacts to do contact tracing, to provide information, as well as to offer them a home visit by a nurse who can vaccinate on site at the contact's residence. We began this pilot effort last Friday in East Los Angeles in Service Planning Area 4, where, as you know, there are several neighborhoods that have been hardest hit by the pandemic. If we find that this strategy works, we'd likely expand into SPAs 6 and 1, where low vaccination rates still remain. We're also continuing to provide gift cards for people who complete the case investigation interviews, which helps us identify contacts and helps us begin our contact tracing efforts. And we're also going into the field to interview cases in their homes, which is something that we were not able to do earlier on in the pandemic. We also have ongoing partnerships with Parks After Dark. We have some with McDonald's, YMCA's, and other sites to bring vaccines to community events. And our priority, again, continues to be that those communities with lowest vaccination rates and those hardest hits are the ones that are getting this additional support. Next slide, please. Just as a reminder, this is something you've seen before, just in terms of the vaccines and whether or not they're effective against the various variants that are here. This again presents the numbers in LA County, and please note that that this is often updated as we get new information. But again, this is what we've seen in the past related to the variants and fully vaccinated people and breakthrough infections. As you can see from here, those who are fully vaccinated, if you look across the various variants that are circulating here in LA County, the relative percentage of fully vaccinated people, and again, this is a small number in total of all these specimens, are pretty similar across the variants. And so they are showing similar protection across all variants. And again, the majority of people being infected are those who are not fully vaccinated. Take the next slide, please. Again, you've seen this metric before, just as a reminder in terms of how effective the vaccines are. And I'll just remind you that 0.06% of people who were fully vaccinated tested positive more than 2 weeks after they were vaccinated with their last dose. 0.04% were hospitalized related to their infection, and 0.0004% died. Next slide, please. Just as a reminder, in order for all of us to keep ourselves safe during this time as we continue to see how the variants and this virus continues to circulate in our community, with transmission on the rise, the best protection from COVID-19 is to be fully vaccinated. And even after you've been infected or had COVID or recovered, it is still recommended by the CDC. Their studies have shown that vaccinations provide a strong boost in protection in people who have recovered from COVID-19. The vaccines, again, are free and have been shown to be safe and effective. And if you're worried about not feeling well after getting vaccinated, or you or your family member are ill with COVID, you may be eligible for paid sick leave through either the county or the state. If you do get a call and it shows up as LA Public Health or 833-641-0305, again, 833-641-0305, please answer that call. It's one of our case investigators or contact tracers, and completing these interviews also plays an important role in reducing the spread of infection. And it's their job to keep your identity confidential. They do not share your name with people who are potentially exposed. They don't ask about your immigration status or cooperate with any groups that are concerned with immigration. And additionally, a call from a contact tracer just isn't about getting information from you, It's also helping connect you to resources if you need to be tested or get vaccinated. And also, if needed, to provide resources to quarantine and isolate safely, including access to food and housing. And so thank you for helping us, for all who have responded to this. And those who do complete the case interviews, again, we'll send a $20 gift card after the call. So again, if you do get a call from a contact tracer, please answer it. And again, the number would show up as LA Public Health or 833-641-0305 if you have caller ID on your phone. I want to encourage everyone to continue to mask indoors regardless of vaccination status if it's not being checked when you're going in, and masking indoors in public places is required if you're not fully vaccinated against COVID-19. Again, masks are a great way to prevent you from being infected, or if you're unknowingly ill, prevent you from spreading it to others. And lastly, it's not on the slide, but I do want to recommend that, especially if you're unvaccinated, reconsider traveling to places where the 7-day COVID-19 case rates are increasing or high, like Nevada, our neighbor, or Missouri, Florida, Arkansas, or Louisiana, among others. You can check the CDC data tracker webpage for more information on other locations. Every action counts, and we're all in this together. I'd like to end my presentation by thanking our many community and county partners for their ongoing efforts to increase vaccination rates across LA County. And I also want to thank the millions of county residents, our parents, grandparents, teens, and workers who have gotten vaccinated. These efforts have a dramatic impact on our collective well-being throughout our recovery, and there continues to be work to keep up this progress, and I thank everyone for their continued commitment to this work. Thank you, and I'm happy to answer questions after Dr. Galley's remarks.
Thank you very much. Dr. Galley?
Yeah, good morning, supervisors. Thank you. I'll give a brief update this morning on vaccinations, testing access, and hospitalizations. First, if you could turn to the quick slides on vaccinations. Slide 2, thank you, shows the total vaccination effort that's been performed by DHS clinics and staff to date. As you can see, similar to the trends Dr. Davis shared across Los Angeles County, we have experienced a leveling off over the past several weeks as acceptance of the COVID vaccinations has substantially slowed. DHS still operates a number of vaccination sites at all of our clinics and workplaces, but we have significantly less uptake of the vaccine than we had earlier in the pandemic. We are working to address vaccine hesitancy through a variety of modalities.
I hope we didn't lose you. Dr. Galley? Did you mute yourself? Unmute? Okay, I think we lost her. We tried. Okay, since we are not able to speak to her directly, why don't we just move on, and then members have questions, I think, for Dr. Davis. So we'll go ahead and start with Sheila Kuehl, Holly Mitchell, and then Janice on.
Thank you very much. Thank you, Madam Chair. I really, really appreciate it. I think some of this may be for Dr. Galley, so we may ask again if she gets reconnected. But my question really goes to remembering back to when we had several surges over the past year and a half, and the concerns that we had about the fatigue, the sort of psychological well-being, and the physical well-being of all of our healthcare workers. My own opinion about people who still will not get vaccinated is that they really are not taking into account the impact that they may have on these healthcare workers who often are from the same communities and have been put at risk. And now that they're vaccinated, perhaps less at risk for getting COVID, but not less at risk
Nothing.
for their fatigue and overwork and just the burden that we put on them. So I wanted to ask Dr. Davis and Dr. Galley, if she gets back on, about the impact of the growing number of cases on our healthcare workers. The numbers, if we have sufficient numbers and resources in the hospitals, in the clinics, and all the places where this places a new burden on our healthcare workers.
Okay, very good. I think we got reconnected. Dr. Galley, did you hear the question? Dr. Galley?
I'm sorry, are you able to hear me?
Yes, we can.
Okay, I'm sorry. Could you repeat the question again? I was trying to troubleshoot the technical issues.
Of course. And, I'm reminded that we've had complaints in the past at other meetings about people who thought their mics were cut off because we didn't like what they were saying. And now they should really realize that it's just all technology, because we liked what you were saying, although it was troubling. My question went to the impact of the growing numbers of cases among unvaccinated people primarily, the impact on our healthcare workers, reminded that they were so overwhelmed during the time that so many people were sick, coming in for treatment, etc. And I can't imagine that they've really recovered in terms of their fatigue, in terms of the impact on their mental health. So I wanted to ask about our healthcare workers and whether we have any assessment of their ability to meet this new, growing demand.
Dr. Galley, you want to respond? Goodness. I may have lost her again.
Yeah, it's hard this way, isn't it?
Maybe Dr. Davis can chime in if he feels he can address this. Dr. Davis? Did we lose him too?
Yeah, I think we're all on, but having trouble with their continuing connection. Well,
Okay.
I'll hold my question, obviously, until either of our doctors or both can get back on the line.
Okay. All right, let's move on. Next question is from Supervisor Mitchell. Supervisor Mitchell? Oh, is that Dr. Davis?
There's Dr. Davis, yeah.
Okay, Dr. Davis?
So are you able to hear me, or did you get broken up as well? Did I get broken up as well?
No, we can hear you right now. Did you hear my question, Dr. Davis?
I did, and I was responding, so I'm not sure what's happening. It's going in and out, I guess.
Yeah, start over.
Okay. So I was saying that I believe Dr. Galley can provide a better perspective just in terms of her workforce and their sense of fatigue. I do know that healthcare providers are concerned and are noting that they're strikingly seeing younger groups of people coming into the emergency department or being admitted. Preliminarily, we're seeing an increase, especially in our 30 to 49-year-olds. So the threat of having more people in the hospital, I think, is daunting to consider for many healthcare providers, especially those in the hospitals. And we don't want to see that, but I'll turn it over to Dr. Galley if she's able to provide comments related to her staff and her perspective.
Are you able to hear me?
Yes. Go ahead, Dr. Galley.
Okay, sorry, I'm not sure what's going on with the IT problems, but I'll try to address it's an excellent question, Supervisor Kuehl, and thanks for mentioning this. It's been a lot of toll and a lot of stress on the healthcare workers over the last 18 months. And certainly the stress that they're experiencing now is not anything close to what it was in the midst of the surge earlier this year. But still, the months add on top of one another, and I think it's really challenging to see patients come in so sick, especially when virtually all of them, and to date, we have not had a patient admitted to a DHS hospital who has been fully vaccinated with either the J&J, Pfizer, or Moderna vaccine. Every single patient that we've admitted for COVID has been not yet fully vaccinated. And that's hard for the healthcare workers to see. They've spent hours, effort, energy trying to care for patients. And at this point, this really is a preventable illness, a preventable infection. And the healthcare workers will continue doing everything they can to support the lives and health of the individuals that come in. But it's really been a very challenging year, and I think it made all the more challenging because we see the suffering that these patients and their families are going through, and it's very preventable at this point in time.
Thank you very much, Madam Chair. I really want to continue to express a prayer to all of those who are not vaccinated to understand the impact that they have not only on their communities and their families, but on other people in their communities who are the healthcare workers, who are the people toiling more than 14, 15, 16 hours a day to take care of them when they don't want to take care of themselves. And I'm sorry to sound a little angry, but it just strikes me as enormously selfish. We can't rely on herd immunity if the herd won't get their shots. So I thank you very much for allowing me to ask the question.
Thank you. Very on point. Supervisor Mitchell. Supervisor Mitchell, you're recognized. Okay. We'll go to next to Supervisor Hahn, and we'll come back to.
Thank you, Madam Chair. Thank you. You know, I really appreciate, Supervisor Kuehl, your heartfelt angst over all those who are not getting vaccinated, as well as for our healthcare workers. I believe there's a motion on our agenda today about creating a well-being officer to specifically help those who are frontline healthcare workers, because you're right, they have not gotten over the trauma of the last surge, and to see our cases, you know, going up by 1,000 every day is very unnerving, and it really gives you a feeling of deja vu for for March of 2020, and how they just kept doubling, tripling until next thing you know, we had the mercy ship here. So it's very unnerving. And the difference right now is that we have vaccines. So that's the big difference. Last year at this time, it was a very different situation. Now we have vaccines, and it's so troubling that last third is just not going to get vaccinated. I would ask both Dr. Gowling and Dr. Davis, they do say, right, that the worst messengers are government officials. You know, it's like Reagan said, I'm from the government and I'm here to help you, right? And the best messengers are those in the community. They're the ones that should be going door to door, the pastors, the community members, the block captains, the Little League coach. Those are the people that should be going door to door, not professional government healthcare workers. Have you, either one of you, looked at that? And who are we actually using for those door to door messengers? First question.
Sorry, I guess I can go. Go ahead, Christine.
Thanks. I'll start briefly. Can you hear me okay?
Yes.
Okay, great. Thanks, Supervisor Hahn. It's a great question, and I think the point well taken, and you're absolutely right. People's first choice about where they get their message from wouldn't necessarily be government officials, and that's why it's so important to get just people's colleagues and peers and trusted sources of information out there, giving them messages about COVID, about the need for quarantine and isolation and testing, and critically at this point in the pandemic for vaccination. DPH and DHS have partnered on the COVID Equity Fund, and we use community health workers and various community-based nonprofit organizations to do just what you said, get the message out by going door to door, but using people who know the communities, who are trusted in the communities and have existing relationships. I would also extend your point just to encourage everyone who's listening to just use their friends, their network, their peers, people that they interact with, whether it's on the Little League field or at work or at church or temple or wherever they interact with other people, to tell their stories about why they chose to get vaccinated. Because people really do want to hear from people they know in their personal lives, and they listen. And you never know when that story will make a difference in helping someone understand some of the advantages of vaccination and maybe make a choice to be vaccinated.
Mm-hmm. Well, I just hope that we can, really drill down on that with this last group that really needs to get vaccinated. And I know we have to tell the truth about our vaccines. I'm worried that the latest revelation about the J&J shot that might cause autoimmune issues is sort of the last thing that those people will probably want to hear, and will probably, in my opinion, drive them even further into their bubble of just feeling like they aren't FDA approved and they're just going to wait. So I am worried about that. Dr. Davis, I noticed on one of the slides you talked about if someone calls you, make sure you answer. But last week, Dr. Farrar said you were no longer going to be calling for contact tracing, but instead visiting personally everyone who tested positive. And I even questioned the reality of that statement. Like, if 4 days in a row, if that's 1,000, that's 4,000 people all over LA County. I wasn't quite sure that we had the resources to do that, but I noticed you are going back to talking about calling. What are we doing?
Yeah, it's actually both. So if our case investigators go out, they can't reach the person, they'll call, to do follow-up, to let them know that they stopped by and that they're trying to reach them. The same thing in terms of, close contacts. So we try to use every mechanism to get to people. But at the moment, the first mechanism is to go out and visit. But in order to kind of help with time and making sure people are aware and know to answer the door if we're coming back, we do use both methods.
Right. I was a little concerned about contact tracing the last go around. I just never felt like we did it properly. And we do know a lot of people don't answer their phones. A lot of people don't want to spend any minutes on filling out a survey, even if it's on the phone. So I do think you should drill down a little bit and come up with a very succinct interview process and really get to the heart of what you're trying to figure out in terms of where, when, and how someone was infected, and whether or not, as Dr. Farrar said last week, we need to offer vaccines to others in the household. I'm concerned about how we quarantine. I don't feel like we did it well last time around. But again, my encouragement that you really get on this. And the last question, it looks like we will be requiring booster shots. I guess CDC is still trying to determine that, but looks like that's probably going to happen, particularly for those who got vaccinated maybe early on in the process, last December or January of this year. Particularly the elder, the more vulnerable are those who are in long-term care facilities. Are we planning, what's your thought? Are we going to just kind of redo the whole vaccination process, the mass sites, the going to these facilities? How are you envisioning we do the booster shot regime when we realize it's time to do that?
Yeah, thank you, Supervisor Hahn. Just to comment on a couple of things you also said, in terms of contact tracing, this is something we do day in and day out, and we've continued to try to improve the process as we, see different outcomes, in terms of people responding. And so we will always continue to try to improve upon that. In terms of the booster shot, I think, it caused a lot of questions, when the news said, well, I believe it was Pfizer who said, we're going to try to get approval for a booster. But the CDC and the FDA both commented that based on their, science-based analysis, there's no recommendation for a booster shot at this time. So I do want people to understand that. I think as we start to get back into boosters, if we ever get to boosters being needed, based on the data, it'd probably be a mix of things. I think it depends on one, how quickly is that needed? But I'm sure there would be, a mix of both, the county providing some, locations for people to go, but we've also have a pretty wide network of providers who are used to doing this and are able to do this. I'll remind you that our large pod sites got smaller and more sites became in the neighborhoods, not necessarily run by us. And so I think that same network would still be used, to do it. I think the question at the time would be, what's the demand, and is the booster, if it ever gets to that point, specified for a certain age group or, a time period, from the last dose of vaccination.
I mean, again, I'm not a doctor. I don't even play one on TV, but I feel like we're going to end up getting boosters. I actually have a friend who got 2 Pfizer shots and then just on his own went and got a third shot, a J&J shot. Is that, you feel like, do you recommend that course of action?
No, it hasn't been recommended.
Okay, good.
Evaluated it, in terms of whether or not it really does boost your, potential protection. So I think that remains to be seen. At this point, they've been pretty strong that the vaccines that we currently have and the recommended schedule of dosing for those vaccines is still very effective in terms of preventing serious outcomes. And in many instances, it does reduce your risk of being infected.
Okay, thank you. Thank you, Madam Chair. I yield my time.
Thank you. I know, Dr. Galley, you're still with us, I hope.
Yes, I'm still here.
Because did you want to just finish up your last couple of pages and then I'll turn it over to Supervisor Mitchell so we have that?
Sure, I'd be happy to do that. I'm not sure where I cut out before, but if you could maybe go to slide 3.
Yeah, that's where you left off.
Okay, thank you. So this slide shows progress in vaccinating DHS patients who are age 12 and older. This data was recently updated to include data from the California Immunization Registry through a query that was completed at the end of June. I'll remind you that there's not an automatic interface between the California Immunization Registry and electronic health records as held by providers. So it's a complicated query to be able to pull in information in an aggregate form about which patients have been vaccinated outside of that provider system. But this does include the full world of data for our patients and whether or not they are vaccinated or not. Notably, you'll see that the rate is highest among Asian patients at approximately 75%. And similar to the data that Dr. Davis presented a few minutes ago, rates are half that among Black and African American patients at just under 40%. Among Asian, Black, and white patients, the rates of vaccination uptake are similar among men and women, but rates among men are lower than that among women among those of Hispanic, Latino, or Native Hawaiian and other Pacific Islander heritage. The next slide on slide 4 shows that same data, but for the individuals who are age 65 and over. You'll see obviously the rates are higher and they are more similar across racial and ethnic groups, but the rates are still lowest among Black and African Americans, both men and women, as well as among male, Native Hawaiian, and other Pacific Islanders, and slightly also lower among white women. The next slide, slide 5, summarizes the data and progress for DHS patients, including total vaccinations that have been given from all sources. In the interest of time, I'll skip just quickly to the next slide, slide 6, which shows progress in vaccinations performed by their Housing for Health team among persons experiencing homelessness. As a reminder, other entities beyond Housing for Health are also involved in vaccinating this vulnerable population. And that data is not kept by DHS and is not further shared here. This just includes this data that of vaccinations performed by the Housing for Health teams. In total, over 12,000 vaccinations have been given to date among staff and clients, with over 6,500 persons experiencing homelessness who have been fully vaccinated by Housing for Health staff. The pie chart in the corner shows the locations of where those vaccinations among the PEH population where they've been delivered. About half have been provided among individuals in encampments, about a third in the interim housing and shelter sites, 12% in Project Brimkey and Project Home Key sites, and the small remainder in permanent supportive housing and QI sites. The next slide, slide 7, shows progress in the jail. To date, over 14,000 vaccinations have been given in the jail, with over 8,000 individuals in jail who are fully vaccinated. All individuals entering the LA County jail system are offered the COVID vaccine. In addition to the data that's shown here, an additional 300 or so vaccinations have been given to youth in the juvenile halls and camps. Again, all youth entering the halls and camps are also offered the vaccine. However, parental consent is required unless the minor is emancipated. The next slide shows the current status of where individuals can access COVID testing. There's a lot of sites that are spread across Los Angeles County. Especially given the rise in the Delta variant, I would continue to encourage LA County residents to seek testing if they have any symptoms of COVID, particularly if they are not fully vaccinated. Given the uptake in the percent positivity rate, we will be putting on hold any further closures of testing sites until the case rates plateau and again decline. And then finally, before I close, I'll comment just briefly on the status of hospitalizations within DHS. We have seen a slight uptick in the number of individuals who have been hospitalized from COVID. However, the numbers are also still thankfully quite low. As of this morning, we only had 23 patients who were hospitalized this morning across the 4 DHS hospitals who were hospitalized for COVID. All patients, as I mentioned earlier, who have been admitted to date in DHS's 4 hospitals are not yet fully vaccinated with US approved vaccines. Said a bit differently, we have not admitted any single person for COVID who is fully vaccinated with either the J&J, Pfizer, or Moderna vaccine. This really is a very serious illness. Death can sadly result from a large share of the individuals who are hospitalized with COVID, but that is a preventable outcome at this point, given that the vaccine is so widely available to individuals who are age 12 and over. So I would really strongly encourage people to think about getting the vaccine if they haven't yet made a choice to do so. And as I mentioned earlier, if you have received the vaccine, please tell your story to others and encourage people within your sphere of influence to make a potential choice to get vaccinated. And happy to answer any further questions. Thank you.
Thank you. Supervisor Mitchell, you're recognized.
Thank you very much, Madam Chair. Let me start by acknowledging the hard work of the IT professionals that have served the board, the executive office, and the entire county. They have stood up systems and maintained systems throughout the pandemic. So I thank them, because as we have experienced today, when it fails us, it can be so frustrating. So I want to thank the IT professionals for all that they do and lend my voice to saying that I too look forward to when we don't have to rely on this system and we can safely and appropriately meet in person again. I was sitting here hitting every unmute button and you all still couldn't hear me. So thanks for coming to save me, to the folks in IT. Very quickly, Madam Chair, to Dr. Galley, I want to applaud the Housing for Health teams and all that you've done to make sure that our unhoused family, friends, and neighbors have had access to both testing and vaccines. I noted your comment about, that the county isn't the only service provider vaccinating that population. And so I'm struck by, data we've seen, quite frankly, in the press, front page LA Times articles the last couple of days that attribute a significant percentage of our increase in our case incidence rate to the unhoused. So my question is, what must we do, not only through your Housing for Health teams, but broadly across the county in collaboration with others to increase the vaccination rates among that population? We've talked a lot about, outreach efforts, the door-to-door work, looking at the, ethnic disparities, but what are we going to do to really increase vaccination rates among our unhoused? What can we do?
Thanks, Supervisor, for that question. I'm happy to start, and then I don't know if Dr. Davis wants to add in. I think that the solutions to how to get higher uptake among the population that is experiencing homelessness is really quite similar to what we need to do among the general population. Those relationships really matter. And a lot of times, individuals who are on the streets or living in shelters have trusted relationships with case managers or relationships that can be developed through street outreach workers and case managers, and really trying to use those relationships in a way that can present individuals who are experiencing homelessness with an opportunity to ask their questions, to get fact-based information about the vaccine, to be given a chance to just talk through their concerns, even over multiple conversations and multiple encounters. That's what we found through our homeless Housing for Health street outreach teams to be the most effective, is just those one-on-one conversations. It's very labor intensive. It's not always very fast. It takes time, but that's been the best thing that has really helped. We're also looking at other things such as providing incentives, additional gift cards, and other things, but I really think a lot of it comes down to those one-on-one individual relationships.
Thank you for that. Dr. Davis, anything you'd want to add before I move on to my next question?
Just really quickly, I think your comment about people feeling like the cases are largely, driven in that group, and they're not. The 1,000 cases we're talking about, they're really nowhere near high in terms of driving that rate. So I just want to put that in perspective.
Oh, okay. Thank you, because that wasn't the impression I got, at least from one article that I read this week. Secondly, that's good to hear. In response to Supervisor Hahn's question about the door-to-door, I couldn't agree more that we, influencers and other trusted sources, I think, are really important. And I'm hoping that the county will do what the state is going to do. When Secretary Yolanda Richardson was here about a month or so ago now, and went on, spent a day doing door-to-door visits with some of the CBOs the state had contracted with, her takeaway and aha moment was that it's this kind of community-based organizing that we, rely on for a variety of issues and reasons. And so she talked about the state, she was committing to those CBOs that she would continue their contracts because, a year from now, we may need to continue to do door-to-door education around, perhaps the next variant, or even the importance of flu shots coming up on flu season. So I'm hoping that the county will continue to figure out a way that we can continue to partner with these 400 plus CBOs where we're doing the pop-up vaccination sites and the door-to-door outreach. Because for them to hire outreach specialists, to train, I think we in government, county and state level, will continue to rely on and need that kind of community-based intermediary, if you will, to communicate necessary public health messages. So I'm really hoping the county will consider continuing, Department of Public Health specifically, and DHS, to maintain those contracts so those community-based organizations, still have our support to do that work. My last question, Dr. Davis, is for you. Your screen on the case incidence rate and the rate of increase was really very sobering. Very sobering. And so we know we've got to do all that we can to get folks vaccinated. But people spend a lot of time talking, folks who call our offices, in the press, concerned about the breakthrough rates for those who are vaccinated, particularly with regard to the Delta variant. I'm wondering if the breakthrough rates actually have exceeded what you anticipated the typical kind of vaccine failure rates to be. Has it exceeded what that, we heard, I think the vaccine was 98%, whatever. So have the breakthrough rates exceeded that 3%, give or take, that you would have anticipated failure as all vaccines have?
Appreciate that question, Supervisor Mitchell. I think when each of the vaccines had different effectiveness in the clinical trials, and what we really wanted to see was what happens in real life. Real life situations where people are out and about and going about their lives in the same way. And I would say that, no vaccine is 100% effective. I think what we're seeing, even as we looked at the slide among our fully vaccinated people, is still much better than what we saw in terms of the studies, at least for our group of folks. I know the state is doing an analysis as well, but nothing, even from the CDC, has said that the breakthrough cases are anything that is beyond what they expected or that they would think might happen. And so they continue to, and we continue to see supported in the data, promote the effectiveness of the vaccines, authorized for what they were authorized for. And I will note that when the study's emergency use was authorized, it was really about preventing hospitalizations and death. And then there were subsequent studies by the CDC looking back and showed that they did also provide some protection, significant protection against getting infected. Although, again, that's not 100%, but that was something that wasn't identified in the studies.
Thank you. I think that's important to communicate because as, we attempt to respond to the issues people raise as their reasons for choosing not to be vaccinated, I think acknowledging that the breakthrough, even for the Delta variant, is what would have been expected, based on the research. So that was very helpful. Madam Chair, thank you.
Thank you very much. I want to thank both Dr. Galley and Dr. Davis. Dr. Davis, thank you for a great presentation, and want to thank both staffs, your agencies for all you do, and just want to call attention to some of the unique things that are happening on the ground that may not be getting a lot of press coverage, but having mobile units with vaccine in hand, going out to places as far away as Pomona in my district on the very far east end, and spending time over the weekend vaccinating over almost 300 people at a swap meet. Unbelievable. And giving people gift cards that wanted it. I can't even begin to tell you the work that the promotoras did to help get people there as well. Most were Spanish speakers, immigrant, and folks that just really had a different idea about what the vaccine was about. And having gone back twice and 3 times now, people were coming around, and I was very happy and pleased to hear that we had close to 300 people show up in Pomona. But those kinds of efforts are working. We also had a mobile unit go out to one of our local churches in the Union Pacific area, which has a very low vaccination rate. That's the same area that's impacted by the Exide battery recycling plant. And I can tell you that we had about 63 people who came out, most of whom came in the late afternoon. And I just want to encourage us, our staff, if we could think more about the essential workers that can't make it between 8 to 5, and that we allow for staff to work at different hours, maybe 5 to 8 in the evening on weeknights or Friday, and then perhaps on Saturday and Sunday. I know that's asking a lot, but perhaps shifting our focus also on Sundays during, when people are out attending mass or attending soccer games or just out at our Parks After Dark events. I really do think we could be utilizing our staff, and if there's a shortage in some way, perhaps we can focus in on our disaster worker teams that have been so great and helpful in providing food distribution as well as COVID testing that could possibly be utilized in that manner. I know I've had a discussion with the CEO about it, and I hope that we can look forward to this, because I do believe we're going to see a continued increase in the number of the Delta variant in our low-income and communities of color, as you have already stated. But I want to thank both of you and hope that we can continue to try to get the information as clearly as we can, that the best way to not end up in the hospital and getting ill or sick or losing your life is by being one of those individuals that's vaccinated. So thank you both. And if there aren't any other questions, if there are any other members, Catherine Barger, I want to respect you if you wanted to ask a question, and if not, that's fine.
Thank you. I have one question. I think Sheila had mentioned it, I guess maybe to Dr. Davis. In terms of the Delta variants, and you may have said this, but the number of cases going up, and I think you said it was out of 5 cases, 4 are the Delta variants. I think I saw that in one of Dr. Farrar's memos. Is it the unvaccinated that are continuing the momentum in terms of the numbers increasing, even to those that are vaccinated?
Yeah, this is largely, unvaccinated people. The breakthrough cases, when we look at the specimens, from, over 7,000 people, who had infections and had their samples sequenced to identify the type of variant or virus they had. Over 90% of those cases are unvaccinated people, are not fully vaccinated people. So, the vaccines, again, have been very protective in this regard. We do have to take this with under consideration that not every case gets to be sequenced. But by far, what we're hearing in terms of people ending up in the hospital, what we're seeing in terms of this data, and what we're hearing from across the nation in terms of the CDC data, this is largely driven by unvaccinated people.
So the longer that people, the longer that we don't get people vaccinated and the numbers increase, what's the probability of more mutation within LA County or just across the board?
Yeah, that's I appreciate that. That's always been a concern. Every infection could lead to a mutation or a change in the virus. We don't know what that mutation will ultimately be, if it's more infectious, meaning it's spread more easily, or if it will cause more severe disease. So the goal is to try to stop as many infections as possible to reduce that risk that we have something that is more severe than what we're seeing now, even with the Delta variant. And before, our worry was with the Alpha variant or the UK variant. And so the Delta variant is beating out this one. We don't want anything to beat out the Delta variant.
Thank you. Thank you, Madam Chair.
Very much. Thank you both, Dr. Galley and Dr. Davis, for your presentations. Members, this is a receive and filed, so hearing no objections, that will be the order. Okay, members, now we're going to move on to item number 2, which is revisiting the recommendations on cannabis regulation in Los Angeles County, which was held by Supervisor Hahn. And then item 10, enhance enforcement against water theft and illegal cannabis grows in the Antelope Valley and illegal cannabis dispensaries in unincorporated areas, which was held by Supervisor Barger. So we'll begin with Supervisor Hahn with item number 2.
Thank you, Madam Chair. Thank you, Supervisor Solis, for co-authoring this item 2 with me. 4.5 years ago, the voters of California approved Prop 64 legalizing recreational cannabis in California. Prop 64 passed with a pretty significant margin, especially here in LA County, where almost 60% of the voters approved the measure. But while Prop 64 decriminalized the use of cannabis statewide, it left it up to local jurisdictions to allow production and distribution in their own areas. So in 2017, this board enacted a ban on commercial cannabis in the unincorporated areas to buy us some time to figure out all the details. We created the Office of Cannabis Management, who then put together the Cannabis Advisory Working Group. And we heard from some of those people during public comment. This advisory group worked really hard and put together a detailed report with 64 recommendations on what the legalization process could look like. But when the report was presented to the board, many of us, including myself, still didn't feel ready to remove the ban. And I admit there were just still too many questions and too many uncertainties, and I didn't want to rush the process before we were ready. And I heard from many of my constituents who also weren't ready for us to take any action. So we put that report on the shelf, and it stayed there collecting dust since 2017. But I think now it's been enough time. We've seen how legalization plays out, and we've seen the rest of the country move in the direction of legalizing, taxing, and regulating cannabis. And so maybe it's time for us to join them. And of course, providing a legal pathway for people to grow, produce, and sell cannabis can help us tackle the illegal market by giving them a legal option instead of simply increasing criminal penalties like was done in the past. And because, as Supervisor Barger said at the last board meeting, the illegal grows and the illegal dispensaries are still a serious issue. And that's why we're voting on her and Supervisor Kuehl's motion to tackle the issue of illegal cannabis, particularly growing in the Antelope Valley. And I want to thank you, Supervisor Barger, for working with us on that motion to get it to a place that I can fully support. At the last board meeting, I talked about my concern that pursuing an increase in criminal penalties for cannabis offenses would be a step backwards towards the era of overly criminalizing cannabis consumption and production, especially when this board hasn't allowed for a legal pathway. So I think the revised motion in front of us right now is much better because it focuses on enforcement of existing laws and regulations, especially when it comes to water theft and water pollution. And I think it goes hand in hand with this motion because providing a legal pathway for cannabis growing, production, and distribution might allow us to better regulate the commercial activity and could even provide us with new enforcement tools. So I think it's time for us to take that report off the shelf. It was amazing to listen to, I know my commissioner Malahat called in and said that it was incredible that they came to consensus on 64 recommendations because it was a very diverse working group. They came from all walks of life, and the fact that they were able to find consensus on 64 recommendations is something I think we should take note of. And so my motion today, along with you, Supervisor Solis, will direct the Office of Cannabis Management to reconvene a group of all the relevant stakeholders, like the Department of Public Health, the Treasury Tax Collector, and the new Anti-Racism, Diversity, and Inclusion Initiative to revisit that recommendation report. We're asking that they spend time reviewing the report and then report back to us with updated recommendations for cannabis retail, manufacturing, distribution, growth, testing, regulation, and enforcement. The updated recommendations should be rooted in an equity framework and should review best practices and take into account lessons learned over the last 3 years. I know many of us were uneasy back in 2018 when we declined to remove the commercial cannabis ban, but I think it's at least time to revisit that conversation and think how we can safely implement the will of the voters when they approve Prop 64. Thank you, Madam Chair.
Thank you. Just as a reminder to the members, we're going to hear the two items and we'll hear from the author and co-authors, and then we'll go into questions. So with that, I want to recognize myself and want to also thank Supervisor Hahn for bringing this very timely motion forward. And I want to thank her for allowing me to join her as co-author. I also want to thank Supervisor Barger and Kuehl for their motion regarding illegal cannabis enforcement. With both of these motions in front of the board, in my opinion, it's evident that the board is aligned and we must act to address the growing number of illegal cannabis dispensaries and growers. They are presenting challenges, particularly to our residents in the unincorporated areas. And especially in my district, the illegal cannabis operations have caused much nuisance and close to 50 operations just in East LA alone that are being monitored. But we have a problem there because once we do go in and identify one area, we see that as soon as we try to close that down in some manner, they pop up somewhere else. So again, it's that revolving door, the whack-a-mole problem that we've talked about for many years. So I think that the county does need additional administrative powers to keep our constituents and especially our youth protected. It's a public health and safety matter. We also need to look at how we regulate cannabis. Since the passage of Prop 64 in 2016, legalizing recreational cannabis in California, there's been a continued shift against criminalizing and toward how jurisdictions regulate the use of cannabis. I know that's true even in the San Gabriel Valley and cities that I represent. In LA County, the board established, as you know, the Office of Cannabis Management Advisory Working Group on cannabis regulation to look at how cannabis regulation could work in unincorporated LA County. And though the board did not move forward, as you know, on 64 recommendations laid out by the work group, given the obstacles around illegal cannabis growers and dispensaries, it's high time that the county review the report again and dust it off. The cities of LA and Long Beach allow for commercial cannabis, which appears to be successful. And as we look at other forms of enforcement and address the mounting water theft, it is critical to have our county stakeholders, including our new Anti-Racism, Diversity, and Inclusion Initiative, review the report and update the prior 64 recommendations and or present new ones to the board for further review. We definitely need to make sure that this is a fair and equitable process. So I want to uplift the motion authored by Supervisor Hahn and require recommendations to be rooted in equity. We need to strike a balance between public health and safety, and we can't arrest our way through all of this, but we can enforce when necessary and find ways to regulate. So thank you. Next, unless Supervisor Mitchell wants to speak on this on item 2, or wait until we hear from the authors of item 10. Okay, let's go ahead and hear from Supervisor Barger and also from then Supervisor Pugh, who's the co-author, and then turn it over for questions that Supervisor Mitchell may have. Thank you.
Thank you. And I want to thank Supervisor Hahn and you, Madam Chair, for bringing this issue forward today. You know, I think that we were on track upon the passing of the proposition to begin to put something in play as it relates to legal cannabis dispensaries. And the Cole memorandum was pulled by I think it was Sessions, which really would have indemnified all local jurisdictions because it's still considered a federal schedule controlled substance. And so I'm assuming, and I guess to the county council, that has been lifted or reinstated, that memorandum indemnifying. Rod?
So thank you, Supervisor. So the memorandum did not indemnify local jurisdictions, but it made very clear that local U.S. attorneys' offices
wouldn't prosecute.
It didn't make it absolutely clear, but yes, that was the intent of that memorandum.
So has that been reinstated? Because that's why I think we put it on hold, because I am all for moving forward. It's not going to address the illegal grows, but I think for all of us that have illegal cannabis dispensaries popping up, it will at least allow us to have a roadmap moving forward. Do we know if that memorandum has been reinstated?
I believe, I don't know if the Cole memorandum has been reinstated, but I'm pretty certain that the Sessions memo has been rescinded. But okay, I will take a look at that, Supervisor, and report back on that and let your office know.
Perfect, because I believe we do need to move forward. With that said, I would like to introduce a friendly amendment to modify the directive slightly, that the updated recommendations should be rooted in an equity framework and should review best practices to consider lessons learned from jurisdictions that have legalized commercial cannabis. And this just comes because of what I've learned in the Antelope Valley, including environmental impacts to biological, ecological, and water resources. So I would ask that at the end of your motion under the we therefore move that it including environmental impacts to biological, ecological, and water resources, if you would accept that.
I would accept that, Supervisor Barger.
Okay. And then as it relates to item number 10, again, the whack-a-mole problem of illegal cannabis dispensaries and now illegal cannabis grows popping up throughout the county has been exacerbated by the lack of regulating and having an ordinance in play. The county should revisit previous report and recommendations, and we hope that we can come up with a framework that meets the will of the voters without disrupting the quality of life of our communities. Specifically, I want to ensure that the revised recommendations restrict cannabis farms and grows in significant ecological areas that are known as SEAs. In addition, as the state enters another potential drought emergency, we need to ensure that the new activity does not further exacerbate water scarcity. The new land uses should only be allowed in areas of the county where identified water supply infrastructure is currently built out or where water rights are identified. In many areas of the county, new residential uses cannot be built because of the state of California, which has restricted the use of trucking or hauling water for new uses. Finally, as we revisit the recommendations from the previous report and apply an equity lens, we must ensure that we prevent any potential overconcentration of cannabis establishments and grows countywide. Specifically, I hope that this review looks at the recommended buffers for sensitive uses and adapts them to the way we currently define sensitive uses. This is especially relevant in the more rural communities of the 5th District, where development patterns can differ from the denser patterns in urban areas. With respect to item number 10, the conversation is brought forth on the heels of multiple national media reports highlighting the illegal marijuana crisis in the Antelope Valley and, quite frankly, in the San Bernardino and Kern counties as well. And though this motion does focus on the Antelope Valley, make no mistake, and I said this 2 weeks ago, illegal marijuana grows are something that impacts the entire county of Los Angeles. Illegal growers are using unregulated chemicals to process marijuana, selling products to legal and illegal dispensaries in and outside the LA basin, endangering cannabis users. Further, when examining the impact of illegal grows outside of consumer health, we cannot overlook the impact this threat has had on human trafficking in addition to the real estate market. Illegal growers traffic in laborers to assist in the cannabis cultivation in both outdoor and indoor grows. Outdoor grows expand over multiple areas in the middle of the valley, surrounded by debris and trash, while indoor grows have taken over homes in residential areas, converting family homes into suburban cannabis farms. While my office has made attempts to, with enhancing enforcement of this matter through our partnership with various county departments, this motion takes definitive steps at enabling the judicial system to take action. I want to thank Supervisor Kuehl for joining me in recognizing the significant threat and the need to take action to ensure the safety of LA County residents and ensuring basic water necessities. And I'll just close with saying that, beyond that, I've seen pictures and actually had people report about the death of wildlife that has come in contact with the illegal toxins being used, the pesticides. And at least 2 bears were found dead adjacent to a marijuana grow because they came in contact with illegal pesticides that were being used to grow the marijuana. So if it's killing our wildlife, imagine what it's doing to those that are coming in contact with it once it's put on the market up for sale. So with that, again, I want to thank you all for bringing both of these issues to the forefront. The time has come for us to take a stance both on a pathway for the legal sale, but also addressing the illegal grows that are taking place. Thank you, Madam Chair.
Your co-author is recognized, Supervisor Kuehl.
Thank you very much, Madam Chair. I want to thank Supervisor Barger for allowing me to co-author this rewritten motion, and even more for working collaboratively to address a number of concerns raised by all of her colleagues when the motion first came on the agenda. I was the original co-author with John Vasconcellos of the item that went on the ballot to legalize the use and sale of marijuana in California. This is something that has been important to me in terms of not demonizing cannabis more than we demonize alcohol, but rather regulating it. However, at the same time, I think it is really important to recognize that organized crime is still alive and well in the United States, in California, and in wanting to really corner this market. And the actions, especially a little bit north of us, in counties north of us, which we just read about twice, actually, last week in our paper, and the kind of water theft and bullying and, frankly, fear mongering among people who want to control this market also had to be recognized. So the substitute motion today was narrowly tailored to address a pressing problem, which is really not only the nuisance of these crops because they are and can be a nuisance, even growing legally, which is about regulation and the quality of life for some county residents, but primarily from illegal cannabis grows and illegal dispensaries. So obviously, traditional law enforcement approaches are only one part of a cohesive approach to a problem where we want to regulate uh, wisely and reasonably. So by asking several county departments to partner on legislative advocacy, administrative enforcement actions, and reasonable steps to distinguish illegal cannabis operations and dispensaries from, for instance, lawful hemp cultivation, we really, I think, are taking a much more nuanced and useful approach. So I think these two motions operate very well together. It is not only going to be crops grown in the open, but indoors. We've seen in other counties warehouses taken over. The use of water is a big concern to us in our drought situation because we are already seeing not only are we possibly suffering from a loss of water, but as we saw as the lakes get lower and lower and the water table gets lower and lower, we may not even have the electricity that is normally generated um, in our large water bodies. It's all connected. So I strongly support number two as amended and thank Supervisor Barger and the author and co-author of item two for accepting that amendment, and will be interested in seeing what grows from this as we go along. Thank you so much.
Very good. Supervisor Mitchell, you're recognized.
Thank you very much, Madam Chair, and I just want to applaud the efforts by all of you in bringing both of these motions forward today, and I will be supporting them both. You know, cannabis is clearly a complex public policy issue, and it merits the full and careful deliberation of this board with input from local land use, environment, enforcement, public health, retail tax, licensing experts, all done again with an equity lens. If anyone would question the complexity of this policy, all you have to do is look at, you know, interesting comments made by Supreme Court Justice Clarence Thomas just in the last couple of weeks, where even he opines about how confusing it must be for people who are attempting to follow cannabis rules in their home state compared to, you know, trying to stay in alignment with federal government IRS rules, not to mention if you live in the city, in a city that has opined on licensing and yet a county that hasn't. So this is a complex public policy issue. And I'm glad to now be the new member of the board who wasn't here in 2017 when you did your initial stakeholder engagement. But have read that report, and I'm looking forward to the update and our ability to now take action. I chaired the Senate Budget Committee when the state initiative passed, and because of the time frame upon which the new law was to take effect, the state legislature didn't have time using the typical legislative calendar to introduce legislation to deal with some of the regulatory issues we needed to address. So we did it through the budget process because once a budget is passed, it becomes law, you know, July 1. So that really catapulted me into this public policy conversation and deepened my appreciation for all the things we had to consider in transitioning this once illegal product and activity into a legal, acceptable one. So I look forward to being engaged in the conversation at the county level. I'm clear the stakes are very high. You know, low-income communities tend to most acutely experience the harm without experiencing any of the promised new economic or improved well-being opportunities that legalization claimed. I'm also clear that we have not yet experienced what we assume the promise multi-millions in new statewide or local revenue was going to be. And I think in clamping down, addressing the issues that District 5 is experiencing will certainly bring hopefully close to the projected revenue into the public coffers. So I look forward to this data-driven analysis that will help inform our decision-making process on behalf of LA County. Congratulations, and I appreciate the work of all of the members who brought these two motions to the table today, and I'll be happy to support them. Thank you, Madam Chair.
Members that would like to make any comment before we vote on these items? Okay. Hearing no other comments, then let's start with item number 2 as amended before us, moved by Supervisor Hahn, and I'll second to approve the item. Madam Executive Officer, please call the roll.
Item 2 as amended is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Great. We'll now vote on item number 10, moved by Supervisor Barger, seconded by Supervisor Kuehl to approve the item. Madam Executive Officer, please call the roll.
Item 10 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Congratulations. Members, now we'll move on to item number 3, the next step in returning Bruce's Beach to its rightful owners, which was held by Supervisor Hahn. Supervisor Hahn, you have the floor.
Thanks, Madam Chair. I hope that by now more people are familiar with the story of Willa and Charles Bruce and what happened to them over 100 years ago, or almost 100 years ago. The land known as Bruce's Beach should never have been taken from this family in a racist attempt to drive out Black families and Black beachgoers. And when I realized that the County of Los Angeles actually owns the land that used to be Bruce's Beach Resort, I knew immediately that we had to give that land back. But it's something that's never been done before. And I know I had a lot of questions and other people had a lot of questions on how that we moved forward. So back in April, this board passed a motion that Supervisor Mitchell and I authored that asked our county council and CEO to report back with the plan on how to do it. We asked them to look into all the details and to lay out a clear pathway with the next steps. And they did. They gave us a report back that really lays out everything clearly and tells us exactly what we need to do in order to transfer Bruce's Beach back to the descendants of Willa and Charles Bruce. For example, one of the things we found out is that the county actually doesn't have the authority to transfer to the land because when the state gave us the land in 1995, it came with strings attached. So Senator Steve Bradford introduced Senate Bill 796 that will remove those strings and allow us to give the land back to the Bruces. And that bill has passed the Senate unanimously, and it's making its way through the Assembly with bipartisan support. And while we wait for SB 796 to pass and the governor to sign it, there are some other questions we need to address locally, like how we're going to make sure we identify the correct descendants of Willa and Charles Bruce. And this report explains that our county treasurer and tax collector are conducting an initial lineage assessment. And then the county is going to bring on a third-party law firm to confirm the legal heirs through a transparent and unbiased process. And since the land hasn't actually been appraised ever, the report includes a process for how to conduct an accurate appraisal and to estimate the value of the land parcels. And of course, this report explores the options for the lifeguard facility that is currently on the land that once belonged to the Bruces. It explores the options for relocation or continued use of the facility. All in all, this report has answers to all of the questions and shows that it is possible and legal to transfer this land back to its rightful owners. But there's a lot that we still need to do. So this motion will direct the CEO to begin implementing the plan that was laid out in this report back to us. And I wanted to give a huge thank you to the whole team who's working on this, especially our County Director of Equity, Dr. Scorza, all of our lawyers from County Council who have tackled this unusual request and come up with a plan for us to move forward together. And of course, a big thank you to Supervisor Holly Mitchell for co-authoring this motion with me. I respectfully asked my colleagues to support it so we can move forward to right this historic wrong. Thank you, Madam Chair.
Supervisor Hahn. Supervisor Mitchell, you recognize.
Thank you, Madam Chair. And again, thanks to Supervisor Hahn for your vision and courage to talk about returning property that was wrongfully absconded away with by government, which is, something the government isn't always willing to talk about, but we've stepped up and talked about it, and I think it's important. As Supervisor Hahn mentioned, yes, I think this story has piqued the curiosity of people all over the country, but I hope it's also piqued the curiosity of people to dig deep and understand that the Bruces weren't a unique situation, that there are dozens of other descendants of formerly enslaved people who not only earned their right to freedom, but earned their right to buy property. Parcels actually surrounding the Bruce parcels of land. Those parcels are currently privately owned. They aren't owned by the government, so we're not in the same position to address it as we are the Bruce property. But I hope it's piqued curiosity to go above and beyond this parcel because unfortunately, the Bruce's experience was not unique. I think that we at the county are on an important road to set a precedent that could be replicated across the country as we work to put actions behind our commitment to an anti-racist agenda and an anti-racist county. This is a strong step forward on that road. And again, most meaningful is the beginning of a debt owed to the Bruce family to return property that was rightfully theirs. We cannot achieve racial equity until we confront our past and make it right. Thank you, Supervisor Hahn, for allowing me to share in this piece of LA County history. Thank you to my former colleague, Senator Bradford, who's chair of the California Legislative Black Caucus, for his valiant efforts around SB 796. And I ask my colleagues for an aye vote. Thank you, Madam Chair.
Thank you. Are there any members that wish to recognize on this item? Okay, seeing none, hearing none. Item 3 is before us. It is moved by Supervisor Hahn, seconded by Supervisor Mitchell to approve the item. Madam Executive Officer, please call the roll.
Item 3 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
I proudly cast my vote aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Congratulations. We'll now move on to item number 5, assessing the safety of high-rise buildings in Los Angeles County, which was held by Supervisor Hahn. Supervisor Hahn, you have the floor.
Me again? Okay.
Yes.
I know you. Thank you, Madam Chair. Let me talk about these high-rise buildings in Los Angeles County. The horrible tragedy that unfolded in Surfside, Florida last month was a wake-up call for all of us. When word got out about what happened, the first thought on people's minds was, could this happen here in LA County? And in the days following the disaster, I heard from many concerned residents of the Marina City Tower Clubs in Marina del Rey who expressed fears about the structural integrity of their own building because it so resembled the condominium complex that collapsed in Florida. To give these residents peace of mind and to make sure that they weren't in any danger, I directed our Department of Public Works Building and Safety team to conduct an initial inspection to ensure the safety of this building. And while they did not find anything that would require emergency action, our inspectors did say that repairs are needed and that building management needs to make those repairs happen. We've also directed the owner of the towers to provide an engineer's report of the building to further assess its needs. And what I've discovered throughout this whole process is that most counties in the country, including our own, don't have recertification processes to make sure that their high-rises are safe as they age. Currently, after we grant the certificate of occupancy, there's no other reevaluation step in place to make sure these residences are completely safe for people to live in. If we're going to really make sure that the Surfside disaster won't happen here in LA County, we need to take steps to fix that issue. That's why this motion before us today will direct our Department of Public Works to get an inventory of high-rise buildings in our unincorporated areas, then require an engineer's assessment of each of these buildings. Importantly, this motion also directs Public Works to explore the possibility of requiring a regular recertification inspection program for these high rises. In addition, we're going to be sending a delegation of county staff to Florida to learn from their experiences and adopt any relevant building code changes for our unincorporated areas. This way, no building will, no pun intended, fall through the cracks, and no one will be put in danger. When people ask, could that happen? Could what happened in Surfside happen in LA County? We need to be 100% sure that our answer is a resounding no. I hope you'll all give this motion your support. Thank you, Madam Chair.
Thank you very much. Are there any members that wish to be recognized on this item? Seeing and hearing none. Item 5 is before us, moved by Supervisor Hahn, seconded by Supervisor Kuehl to approve the item. Madam Executive Officer, please call the roll.
Item 5 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you. We'll now move on to item number 14. This is with respect to Social Security benefits for youth in foster care, which I held. And I will then notice Supervisor Kuehl, who's my co-author, to speak. First of all, I want to thank you, Supervisor Kuehl, for co-authoring this motion with me. You know very well that in many ways the foster care system really hasn't done as much as it can to really protect our foster youth. And this is particularly true when you and I know our children leaving foster care often leave without a robust safety net to ease that transition. And according to a recent report, roughly 10% of foster youth nationwide are eligible for Social Security benefits. Unfortunately, however, my guess is that is an underestimate. The point of Social Security is to provide individuals who have a physical or mental disability who cannot work with benefits so that they do not fall into poverty or worse, homelessness. For foster youth, access to housing has been a high area of need for many years. And however, the COVID-19 pandemic significantly exacerbated that issue. Social Security benefits can help meet these very basic needs because they usually exceed the amount of financial support provided through other safety net programs. And in the case of SSI and SSP, come with automatic linkages to Medi-Cal and vocational support services. Yet, as a recent investigative report from NPR and the Marshall Project indicates, child welfare agencies often do not ensure youth receive these benefits. I was alarmed, actually, to learn the extent to which child welfare agencies nationwide use this funding to reimburse themselves for the cost of the youth being in foster care. And although I know this practice is permitted, I just don't think it's right. In fact, we have a responsibility to ensure every youth who's entitled to Social Security is getting that funding while they are in foster care and upon their exit. And that's exactly what the motion seeks to address. Specifically, the motion directs our Department of Children and Family Services and our Probation Department, working with the Department of Health Services Countywide Benefits Entitlement Services team, to collect the necessary data to ensure that our youth are getting the benefits they're entitled to through any Social Security Administration program. And it also directs the departments to consider changes in policy and funding to ensure they maximize eligibility for Social Security benefits for youth in foster care and conserve the entirety of the youth Social Security benefit in an account to be provided to the youth when they exit care, rather than utilizing the funds for reimbursement of foster care expenditures. In fact, this motion directs the departments to go a step further and ensure a no-cost interest-bearing bank account is created for each eligible youth in foster care to deposit these benefits. CalAble, a savings plan offered by the state of California, is exactly what we should be looking to leverage as it allows eligible individuals to contribute up to $15,000 a year without affecting their public disability benefits. In fact, if youth receive SSI benefits, a CalAble account allows them to save as much as $100,000 with no effect on federal and California state benefits. I know our departments will work to ensure this is provided to every eligible youth, and it is our collective responsibility, in my belief, to do everything possible to make certain that our youth are supported even after they leave our care. Thank you so much. I would also ask for your aye vote on this and would recognize now my co-author, Supervisor Kuehl.
Thank you very much, Madam Chair, and thank you for bringing this important motion to fiscally support our foster youth. I don't think we have ever fully grasped the difficulty for our young people, especially after they age out of the foster care system, and the fact that there are so many fewer connections for them in terms of family or the kind of people that help young people through the earliest times of their being completely on their own. I was troubled, as you were, to learn that some other child welfare jurisdictions did obtain these benefits for their foster youth, but then used it to pay for their care, which is a way of backing out that county's own money and asking the feds to fill it in, which in both of our opinion is just wrong. So this really instructs our department and probation to, first of all, assess their eligibility for the Social Security benefits. I think people think, oh, Social Security, but they're not over 62. No, not those kind, but SSI, to which many of our foster youth are entitled, but nobody ever helps them to apply. And it can be a very, very helpful addition to their fiscal security. So the motion does a couple of things, directs the departments to assess each youth's eligibility and identify how many in the aggregate of applications each department has filed and approved. And perhaps the most important part is the department doesn't keep the SSI money, but they are required to open no cost interest bearing bank accounts in the name of each eligible foster youth. This helps fulfill the pledge that we make to our youth who are exiting our care, that we will assist with housing security, with employment support, and in this case, a real bank account containing Social Security benefits if accrued. So they can leave with a little more solid footing and I think a better chance in life. Thank you for allowing me to co-author, and I too ask for an aye vote.
Supervisor Kuehl, are there any members that would like to be recognized on this item?
Madam Chair, if I may?
Yes, Supervisor Mitchell.
Thank you very much for bringing this item forward. It is a wonderful motion. I just want, as I listened to you both, I just had a red flag go off in my mind. I want to make sure that when these accounts are opened, that those resources, that savings, won't be held against our youth living in foster care, against any other scholarship or entitlement program. I don't want it to be counted against them as an asset. We want this to be value added. So just as you do the work, if we could just make sure that we protect those resources in that way, I think that will get us to our shared goal for our youth. Thank you.
Very good, thank you. Very good. Seeing no other members wishing to be recognized on the item, item 14 is before us. I will move, seconded by Supervisor Q, to approve the item. Madam Executive Officer, please call the roll.
Item 14 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Keel.
Aye.
Supervisor Keel, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you, members. Next, we'll move on to item 16, acknowledge and apologize for the historic mistreatment of California Native Americans by Los Angeles County, which I held. And Supervisor Hahn will be recognized, who's my co-author, after I make an opening statement. Thank you also to the members and Supervisor Hahn for joining me as my co-author. Colleagues, I believe the first step to healing is truth-telling. And it is in this spirit that I brought the motion forward today to formally apologize on behalf of the county government to the Native people of this land which we are on. The first peoples of this land face violence, exploitation, and dispossession at the hands of many government entities, including actions sanctioned or directly carried out by Los Angeles County. Let's begin with the fact that prior to the construction of the San Gabriel mission, local tribes held 100% of the land. Today, they hold 0% of the lands. This didn't happen by accident. They did not voluntarily relocate. Actions were taken by government to forcibly remove Native people, and we know that this happened. So with that fact alone, an official apology, in my opinion, is warranted. But the extent of the harm inflicted upon Native people goes way beyond the land. For example, California Native people, despite guarantees in the Treaty of Guadalupe Hidalgo, were denied state citizenship, voting rights, and the right to testify in court. These acts removed all legal redress for Native peoples and left them to the mercy of anyone who harmed them. Back in 1850, California entered into the Union as a free state. However, the California legislature quickly enacted a series of laws legalizing Indian slavery, which were then enforced by LA County entities. The state legislature passed a bill called the Act for the Government and Protection of Indians, which made loitering and vagrancy criminal offenses punishable by indentured servitude. Any white person could pay a Native person's bail, then compel them to work off the debt. In 1860, amendments were passed that legalized forced servitude for a period of 10 years for Native people accused of vagrancy. The laws also allowed white settlers to gain control of Native children and force them into indentured servitude as well. A white person only had to file a court petition claiming that a child was an orphan or that the parents had agreed to custodial arrangement. At almost every step of the way, county entities had a role to play in the harm inflicted upon Native people at that time. And it should not come as a surprise that these actions are just the tip of the iceberg. We actually do not know the full extent of the harm because, quite frankly, there hasn't been any proper accounting or documentation of these historical wrongs. This motion will set forth a collaboration between the county and local tribe governments to explore and examine the true histories of this land and our relationships within it. And we want this process to be as inclusive as possible. And that's why I want to slightly revise the motion to add the San Manuel Band of Mission Indians and the Quiche right after Ventureño Chumash throughout the motion. We will work together to develop a public statement that acknowledges, corrects, and disseminates the true historical record of the county's relationship with Native people. We must understand the extent of our responsibility so that we can work to undo the harm that has resulted in so many traumas. Let's be clear, the motion is an attempt to force our county to reckon with its past actions, because only then can we heal and move forward together. I ask for your aye vote, and I will now recognize my co-author, Supervisor Hahn. Supervisor Hahn.
Thank you, Madam Chair, and thank you for asking me to be your co-author on this motion. And thank you to our Native American Indian Commission for your leadership in getting us to this point. The crimes and atrocities committed against the Native American people here in LA County, in California, and across the country are a dark stain on our nation's history. An apology is quite literally the least we can do, but it is an important step to begin to heal the wounds of the past. President Reagan and Congress apologized and provided some restitution for the people of the Japanese descent who were incarcerated in internment camps. So we have seen apologies happen before. Governor Newsom has formally issued an apology to Native Americans in 2019, and now it's important that we as a county apologize. We will never be able to make up for the pain and suffering Native Americans were subjected to, but I hope that this marks a new beginning for us and a renewed commitment to working toward a more just future. Thank you, Madam Chair.
Supervisor Hahn. Next, I'll recognize Supervisor Mitchell and then Supervisor Kuehl.
Thank you, Madam Chair, and thank you and to Supervisor Hahn for bringing this important motion forward today. I just wanted to pause briefly and acknowledge whose land we stand on today. And I want to acknowledge the Tonga, the Chumash, and the Kiz tribes for recognizing that we are on, as we apologize, it is their land upon which we currently govern. Thank you, Madam Chair. I'll be supporting the motion.
Very much. Supervisor Kuehl.
Thank you very much to yourself, Madam Chair, and my colleague Supervisor Hahn for bringing the motion. I'm pretty sure it sounds like we all agree this kind of acknowledgement is long overdue. I know that there has been quite a discussion lately across the country about truth-telling and whether in telling the truth, we somehow damage our ability to love our country. I would posit, however, just the opposite, that when we acknowledge those things that we have done, take responsibility, and move forward to really make reparations, to restore, to recognize, to apologize, to do everything we can, we actually are participating in the kind of healing that makes for a great country. And in this case, our great county. We could never undo all the harm. I'm not saying we could ever undo it that's been inflicted on our Native Americans by our very own government at all levels. But we can tell the truth about history and do what is in our power now to support the well-being and preservation of cultural heritage of the Native communities in LA County. We have to acknowledge we're not all that far away from the policies and practices that devastated California tribes. The impacts of that intergenerational trauma are still felt today: health disparities, poverty, lower high school graduation rates. These first stewards of our land, I want to also mention the Gabrielino, were on their land and it was stolen. It was taken for profit. So we need to really understand that impact and whose shoulders we actually stand on. If we stand on the shoulders of those who robbed, we need to get down off those shoulders and do what we can. We actually stand on the shoulders of these first people. And we also have to remember everything else that was taken from them. So in solidarity with our Native American residents, this is a commitment to working toward healing and honoring the tribes that have called this their home for much, much longer than any of our own forebears. Thank you very much, Madam Chair.
Thank you very much, Supervisor Kuehl. Are there any other members that wish to be recognized on this item? Okay, I don't believe I see any. Hearing no other comments, then item 16 as amended is before us. I will move, seconded by Supervisor Hahn, to approve the item. Madam Executive Officer, please call the roll.
Item 16 as amended is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Great. Members will now move on to item number 15, reducing violence countywide, and item 21, community-based crisis response and violence interruption pilot program, which were held by Supervisor Mitchell. Supervisor Mitchell, please unmute your mic to make your remarks.
Thank you very much, Madam Chair. And I'd like to thank Supervisor Barger for your co-authorship on this motion. I also want to acknowledge Supervisors Solis and Hahn for their motion to support these overall efforts of violence prevention and interruption, and thank their staff for working closely with mine to reconcile these two motions. You'll recall at the last meeting I continued this item so we could add in the revisions requested by other board offices and to do our due diligence with the department. At the end of that same meeting, Supervisor Solis and Hahn read in another motion on the same subject matter to invest $5 million in TPI efforts. I think it's important that we act in conjunction with recommendations and best practices to support the important trauma prevention efforts to reduce violence. This issue is complex and data-driven, and I thank the huge lift by the Department of Public Health, OVP, and other departments to collect and analyze this data and produce their recommendations in a number of previous reports. I refer to these reports and recommendations in my motion to ensure that we move in alignment with this research, which included the important input of our community partners on the ground. I'm pleased that we were able to come to a resolution with the First District to allocate a total of $5 million to the communities most impacted by violence. In addition, via our motion, we are also investing $1.3 million to start the Violence Interruption Pilot Program, which will build upon the previous TPI work, further strengthen the community-based violence prevention response for a total of $6.3 million. This pilot will be tracked and analyzed via annual evaluations to ensure it is having the right impact and can be scaled up across the entire county. Finally, I think we need to identify sustainable and continued funding for this work. That's why I'm also asking the CEO to work closely with departments and my staff to identify ongoing funding for OVP's work. I want to thank the board for your tenacious work around violence prevention and its ongoing efforts to find ways we can sustain this work. Because so much work occurred behind the scenes to confirm item 21 indeed satisfactorily addressed the board's intentions and concerns, I'm going to respectfully abstain from voting on item 15. This is just the beginning of further investments to create more peace in our community, and I look forward to much needed progress on this issue. Thank you, Madam Chair.
Next, I'll recognize Supervisor Barger, who is your co-author.
Thank you, and I want to thank Supervisor Mitchell for allowing me to co-author this motion. You know, as was stated, early engagement in our underserved community is critical to empowering our youth and keeping them out of the criminal justice system. Regarding the use of interventionalists in this outreach, I just want to note that it requires significant vetting to ensure that intent and methods are in fact directed toward gang intervention rather than gang recruitment. And I know that that is something that we worked closely in my district to ensure that we are bringing in people that have the ability to do outreach and really work toward gang intervention. When bringing this forward, I believe that we have an opportunity, and I think that partnering with our prioritized cities and community partners in better engaging with our at-risk residents will serve the entire county. So with that, I am proud to be a part of this motion. Thank you, Madam Chair.
Are there any other members on this item? And if not, I'll wait. We'll move on to my item, and that's item 15. You know, I regret to hear, Supervisor Mitchell, that you won't be supporting this because I don't think that we're really on two different tracks here. And I think that oftentimes people may misunderstand how we get things done here in the county. But believe me, I in no way wanted to harm your district, knowing full well that there are extreme circumstances that are faced there with respect to these issues of gang violence and things that have to be addressed. And I realize that. And I am deeply moved by what I see happening around the county, especially mostly in a way of being alarmed, because in the last year and a half, I've seen so much violence in my community, not just in East LA, where it typically has always historically been brought up, but now to see it splintering and going into other parts of the San Gabriel Valley, in Valinda, in the unincorporated areas, Valinda, Bassett, Azusa, West Covina, and I believe also in areas impacting Supervisor Hahn in Hacienda Heights, as well as Hawaiian Gardens, and even in Antelope Valley in the 5th District. So I think this issue is one of all of us, and that's why I had my staff working with Department of Public Health, the Office of Violence Prevention, to talk about how we could expand the pool of money from the original amount that you had brought up in your motion that was directed towards your district, which was for $1.32 million for the 2nd District. When my staff spoke to Public Health, they did tell us that there was actually about $5 million that was available. So with that thinking, I felt it was important for us then to work around the whole county to see how we could provide and foster the type of support that's so much needed in terms of gang intervention. And we heard some of that today when people called in earlier. This is a real problem, and it's a public health problem, and it's one that I think all of us have to put our arms around in a certain manner. I have been expending some of my own discretionary money for the last 3 and 4 years to pay for intervention groups to come in and service the San Gabriel Valley and other parts of East LA, which literally had no boots on the ground. We didn't find any support either from our law enforcement traditional groups that would be available to do this. And perhaps it's just not something that people think twice about. But for me, it's been a living existence for the last few years, especially through the pandemic. And I know that my residents that I represent and in other parts of the county feel very distressed, knowing that loved ones are battling it out in the street, and especially in the last few months where we've had unprecedented numbers of violent deaths because of gang-related activities. I want to see this come to an end just as much as anyone, and therefore I'm asking for support for item 15, reducing violence countywide, because it is a problem that all of us face. So I hope that you'll consider, members, supporting this motion. I don't think it does any harm. I think we're all going in the same direction, and would ask for your aye vote. With that, I would like to recognize my co-author, Supervisor Hahn.
Thank you, Madam Chair. I'm just going to say up front, I'm going to support both of these motions, right? I'm going to vote yes on 15. I'm going to vote yes on 21, because clearly violence prevention is probably more important than ever, right? I feel like, we've been focusing for the last year and a half on this pandemic, and actually crime was down for a while. And I think it just wasn't on our radar for a while. And now we see crime on the uptick. We see vulnerable populations being exposed to crime. Homeless people, we know, particularly women who are in some of these encampments, are victims of crime. So violence prevention is really where we want to be. Every dollar for prevention, saves us money on the back end in terms of the, what it does to devastate families, what it does to our jails, to our whole system. I was told once when I represented, when I was a city council member, that every murder cost $1 million in the city of Los Angeles. When you went through the impact on the family, what it took to investigate the murder, what it took to bring the perpetrator to justice. So clearly, every dollar for violence prevention is important. I think certain communities, are probably impacted more, but I think the issue here that I found was, I was concerned, for instance, to see Hawaiian Gardens as one of the areas with the highest levels of violence in LA County. So I think we just have to make sure we're looking across the board at communities that maybe people didn't think about that were victims of violent crime should be included in this. And I think Holly, one of the best things you said was we need to find a dedicated revenue stream to support violence prevention. Because what we're not talking about today, and I don't think we're going to, is that we're using Measure B funds for this initiative. And we know that when the voters approved Measure B, it was about emergency rooms, trauma centers. We know that the county council has said we can use Measure B funds for this, but I think part of the maybe issue that we need to continue to relook at is how we direct Measure B funds. And again, I am totally in favor of this. I'm going to vote for this, but I know for a fact, I was told before that I couldn't direct Measure B funds, for instance, to the city of Long Beach, who has a emergency preparedness warehouse that they felt really came under the criteria of Measure B, but they had to go through the process. And in fact, they were frustrated when they saw this motion that, it just takes a motion to direct Measure B. So that's a bigger issue. I'm really not going to, bicker about that today. I think this is right and good that we're spending, money on violence prevention. I'm voting for both of them, but maybe going forward, CEO, we could have a bigger discussion on Measure B funds, how we allocate the unallocated Measure B funds. When do we count them? When are they unallocated? And then how each supervisor could benefit from directing some Measure B funds into their own district for violence prevention, for emergency preparedness, for their own hospitals and trauma centers in their own districts. So thank you, Madam Chair.
Very much, Supervisor Hahn. Well said. Supervisor Kuehl, you wish to be recognized.
Yes, thank you, Madam Chair. As the only member who is not an author or a co-author of either one of these, I feel particularly qualified to approve both of them and to speak a little bit about um, the maybe larger issues in which we're engaged with these two motions. I think it's really important to expand our efforts to prevent violence within the communities, to prevent harm to our residents. And I agree with my colleagues that Measure B is an appropriate funding source, and I'll say just a minute later why, but also not the only appropriate funding source. I agree with those who have indicated that we need some ideas from our a very esteemed CEO about how we might establish sustainable and ongoing funding streams to support operating costs and these program costs, in addition to Measure B funds. We put OVP in public health for a couple of reasons. One is there has long been the recognition that violence in the society is a public health epidemic. And as Supervisor Hahn and others have pointed out, through the pandemic, we have seen a rise in anger, in violence, the issues of people on planes, the shooting on the freeways, the uptick in crime, road rage. People are really frustrated. But we've also suspected and are beginning to see an uptick in the kind of violence that our public health department also deals with in OVP. And that goes across all 5 districts: domestic violence, elder abuse, child abuse. All of these things are part of our public health program in the Office of Violence Prevention. But why prevention and why Measure B? Um, Pretty much most of the time, our society puts the resources and energies into addressing the harms caused by violence after it's already occurred. We spend enormous sums of money on trauma centers, law enforcement. Why? Because we hope that these investments will help both heal physical harm caused by violence and maybe make it less likely that people will commit violence in the future. But it is really clear that there is a real value in allocating more resources to preventing violence. Why? Because every person who is not harmed will not be coming into a trauma center, will not be going to a hospital, will not be needing the kind of healing that the county can help with. And that in and of itself is a savings. And therefore, I think an appropriate use of our Measure B money and a smart use. So I am happy to support the motions today. Hopefully, OBP will get the resources it needs and help us achieve our goal of preventing violence in all of our communities before it occurs, because only then, I think, can we really see healthier and certainly safer communities. Thank you, Madam Chair.
Thank you very much, Supervisor Kuehl, for that very eloquent description of the need for this funding and how it does make sense to use Measure B, but obviously looking at other resources that hopefully may come our way through the state government as well as federal government, and it may be philanthropic as well. Members, hearing no other comments, then item.
Madam Chair, can I ask one question
yes.
regarding your motion? And it's just a minor thing, but in your motion, there is no report back or any time in terms of providing the board with an update. Are you thinking about in terms of how we're going to be notified? Because I know that in the motion that we've got, it does talk about 120-day report back and just in writing so that we get a response. Is that something you'd be okay incorporating? Because I think we would all like to get a report back in terms of how it's all being rolled out.
Yeah, I don't think that's a problem. I think it impacts both. Yeah, items. I agree. That's fine as amended.
Thank you, Madam Chair. It's not an amendment.
We can report back. Yes.
Okay, perfect. Okay, thank you. Thank you.
Great. Okay, so item 15 is before us. I will move, seconded by Supervisor Hahn, to approve the item. Madam Executive Officer, please call the roll.
Item 15, as amended to include the report back, is before you. Supervisor Mitchell.
Abstaining.
Supervisor Mitchell abstains. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 4-0 with 1 extension.
Thank you. We'll now move on to item 21, moved by Supervisor Mitchell, seconded by Supervisor Barger, to approve the item. Madam Executive Officer, please call the roll.
Item 21 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Now, members, will move on to item number 24, recovering better than before, ensuring equitable implementation of the American Rescue Plan, which was held by Supervisor Mitchell. Supervisor Mitchell, you're recognized.
Thank you very much, Madam Chair. Appreciate that. As we all are painfully aware, COVID-19 has really attempted, I won't give in, say that it devastated our county, but it is issued a really tough blow, and it's hit our low-income communities and communities of color the hardest and, quite frankly, the cruelest. Many of our families who are already on the financial edge were stripped of their only wage earner. Anxiety levels among children increased and educational attainment levels dropped. Businesses closed, and we followed needed but hard rules around social distancing. Our health system and frontline health workers were stretched to their absolute limit. President Biden and Congress's American Rescue Plan Act provides a historic one-time infusion of federal funds to help LA County and Angelenos recover. So I'm really hoping that we all commit to get this right, because this funding is truly unprecedented. These funds are not a handout. They are intended to help us step up and step forward. The recent exponential rise in both COVID-19 cases and positive test rates reminds us that we are not out of the woods yet. And we must demonstrate that we can do this right. So I want to thank the CEO and the county department heads and the county's workforce for their tireless and courageous work in responding to the crisis caused by this pandemic. I specifically want to thank the CEO and her team for closely working with the department heads to develop innovative projects that will wisely use these Rescue Act funds. This motion, colleagues, directs the CEO with input from key stakeholders to develop equity principles and formulas, which our departments apply to ensure we carefully target those hard to reach or hardly reached populations most needing recovery help. Groups like the Coalition for Equitable Rescue Act Implementation, the Advancement Project, and other partner organizations suggest data-based models that should be considered. I'm sure there are many other organizations doing similar work as well, so we want them at the table. This motion also calls for transparency and accountability. Results truly matter, and it directs that we share efforts, outcomes, and performance with the public for all to see. The motion also directs that we post any opportunities for our communities to compete for grants or contracts funded with Rescue Act funds. It's important that our impacted small businesses and nonprofits and residents get the information they need to benefit from these resources. Too many times, the most in need find themselves at the back of the line. And so I look forward to hearing what we're going to do to change that paradigm and show how we will use these dollars in the best possible way to improve the lives of people who need it and deserve it the most. Thank you very much, Madam Chair, and I ask for an aye vote.
Supervisor Barger, you're recognized as co-author.
Thank you, Madam Chair, and I'd like to thank Supervisor Mitchell for inviting me to co-author this motion. It is vitally important for those communities hardest hit by COVID to get the American Rescue Plan funding in order to ensure the quickest possible recovery. We must ensure an equitable allocation of funds to provide the crucial support and resources that our most vulnerable communities throughout the region deserve. Today's motion is an important opportunity not only to distribute this funding where it is needed the most, but to do so with transparency and, more importantly, with accountability. In addition, the establishment of a public website reporting on our expenditures is essential in maintaining transparency and accountability for this important funding. So again, I want to express my appreciation to Supervisor Mitchell for including me on this motion. I believe this is going to be something that will definitely benefit all of the hardest hit communities, but all of our communities as a whole moving forward. Thank you.
Thank you very much. Next, I'll recognize Supervisor Kuehl, who wants to speak on the item.
Thank you very much, Madam Chair. I strongly support the item and all of the appropriate issues of equity. I think we have been clearly and certainly with this board historically devoted to being realistic about the impacts of COVID and how we can recover, hopefully with the help of the federal government. The reason I want to speak very briefly is I don't want us to forget the devastating impacts on women and girls in every community. There's, the concept of Proposition 209, which I found extremely destructive from the minute it was passed. The equity index will not include gender, it will not include race as, counting in terms of, I guess you would say, where we're the worst off. But in allocating this money, I really, really, really want us to remember how hard hit women were in this pandemic in terms of their employment. They lost more jobs. They are still more out of work. The industries in which they operate are having the hardest time coming back. And so I want us to always pay attention, because it doesn't matter what community you're talking about. If you divide it between how men are doing really bad and how women are doing really, really bad, it's always just a little worse for the women and girls. It doesn't mean they need to be preferred. It simply means they need to be remembered, considered, and cared for. Thank you, Madam Chair.
Are there any other members that want to be recognized on this motion? Okay, seeing none, hearing no other comments, item 24 is before us. Moved by Supervisor Mitchell, seconded by Supervisor Barger to approve the item. Madam Executive Officer, please call the roll.
Item 24 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Keel.
Aye.
Supervisor Keel, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Members, now we'll move on to item number 27, modernize the Los Angeles Homeless Service Authorities, LAHSA existing governance and structure in partnership with the City of Los Angeles, which was held by Supervisor Mitchell. Supervisor Mitchell, you are recognized.
Thank you very much, Madam Chair. I appreciate you. Thanks to Supervisor Kuehl for your partnership in co-authoring this much needed and timely motion to modernize the structure and governance of LAHSA. Since its creation in 1993, LAHSA, as a joint powers authority between the County of LA and the City of LA, has been the target of criticism and blame for the growing social and humanitarian crisis, which has left hundreds of thousands of people stranded on our streets, in our shelters. As government, as policymakers, and as the progressive leaders of our time, we know very well that homelessness does not happen in a vacuum in which our nonprofits and third-party joint powers can simply solve on their own. Homelessness in LA County is and has been, since the early 20th century, a byproduct of all the isms: racism, classism, sexism, deliberate housing policies, and redlining, which have created generational gaps between those who own land and housing and those who've been forced to sit on the margins of society and wait to be forced out of whichever and whatever parts of our neighborhoods they were temporarily allowed to rent. Homelessness is and has been a direct byproduct of our deeply racist justice system and mass incarceration, which has no counterpart in any other part of the world, and is also a byproduct of inequities in our mental health and healthcare delivery systems. Recently, Home Hope, a study by UC San Francisco, showed that 84% of unhoused older adults from the second half of the baby boomer generation had a history of incarceration throughout their lifetime. Again, a result of mass incarceration and the war on drugs against our underrepresented communities and poor people who've been incarcerated and abused by our system since the 80s and 90s. So time and time again, rather than trying to get to the root of the causes of social and racial disparities we see around us, we create institutions designed to solve the effects of the problem rather than the root cause. I think it's time that we all are intentional about forming and transforming agencies to be culturally sensitive and relevant. And we've done this. This board has done this time and time again. Our institutions need to be grounded on historic knowledge that provide trauma-informed care to give each and every individual the tools they need to be successful. And LAHSA is held accountable and often blamed for the homeless crisis, even though it does not inherently, by design, have the power, authority, or capacity to solve the crisis by itself. And again, since its founding, LAHSA's role has evolved from a simple grants administrator to a provider of services, as well as a full systems administrator and policy advisor. However, LAHSA does not have control over its funding, policies, and programs, and receives direction from overlapping oversight bodies, which has made it even more difficult with each year bringing about greater numbers of inflow into the system. If LAHSA hasn't resolved the homeless crisis in LA County, it's not because it's not theirs to solve alone. LAHSA was never designed to solve homelessness because it doesn't have jurisdiction over the production of affordable housing, the numbers of mental health facilities and number of mental health beds available. It has no oversight over our Section 8 system, public health, or the reforming of our justice system, all issues that directly contribute to the number of unhoused on our streets and in our facilities every day. All of these need to work in concert to close the front door of the inflow into homelessness. I recently met with leadership at LAHSA as a part of my own onboarding process joining the board. And I knew that there were many kind of bosses, if you will, or vested interests around the table, but I'm not sure that I even understood or others really fully acknowledge the fact that LASA has 31 key decision makers between the county, the city of LA, and the commission. I've heard repeatedly the desire to expand the number of people around the table beyond the existing 31. I included in the motion as part of Directive 1 an input and engagement process for one critical contributing entity, the Council of Governments, as well as a stakeholder process to have unified outreach engagement and housing placement approach to encampments. And I understand that there are some that think that the 31 isn't enough and having more will solve the challenge, but I don't believe that to be the case. I don't believe that adding more people to the proverbial table will resolve the challenges I just mentioned. And there are those who have called the governance of LASA chaos because everyone is in charge and yet no one is in charge or can be held accountable. I believe that we need intentional leadership as well as meaningful engagement. And that's why the motion before us today is inclusive of amendments crafted after discussions with my colleagues, department leadership, and community stakeholders. Our goal with this motion is to bring our county and city together to have an open and honest and consistent conversation about what LASA is and what it's not. And as opposed to getting involved in the blame game about whose inability to solve the crisis it is to really give it a job description that it will actually be able to perform and succeed at. And so this motion is introduced in an effort to create a body by the government that actually works and is set up to succeed rather than fail, and to create lasting and effective relationships between the city, the county, and LASA to solve problems together which serve our communities rather than divide them. I'd like other departments, along with our own board and the city of LA, to work together to create an intergovernmental body of governance and to finally align our vision, mission, to set realistic goals and timelines to meet those goals. So I'm asking for a report back within 90 days on the implementation of a modernized LASA organizational structure that is appropriate to the times in which we live and to the abilities of LASA as a joint powers authority. I ask for your aye vote.
Supervisor Kuehl, you're recognized.
Thank you very much, Madam Chair, and thanks to Supervisor Mitchell for giving me the opportunity to co-author the motion. It's also timely as we're also considering the fifth year Measure H budget this afternoon. As you mentioned, since its creation, LAS has moved from simply being a grants administrator to a system administrator and policy advisor. Tremendous growth over the last 5 years, which brings opportunity and responsibility to evaluate the progress we've made and to make, adjustments. There have been a lot of discussions about governance over the last 12 months, 4 different reports by the county, by the city, by LASA, by Weingart, with a variety of recommendations to improve LASA. But one recommendation uplifted in multiple reports is the need to establish a system-wide vision, goals, and outcome measurement. So last month, as you mentioned, some of our colleagues, led by our former colleague on this board, Mr. Ridley Thomas, took action to advance some improvement in the system. So it's an opportunity to collaborate more effectively with our city colleagues at an intergovernmental table. The motion asks for an analysis on how to do this. I like the fact that it's a report back. I also very strongly agree with how difficult it is for LASA when it has no way at all to control how much influx into homelessness there is in the county. more people becoming homeless every day than we can house, even though we're housing thousands every year. It's kind of like somebody, we don't know who, is throwing a bunch of people off of a bridge. And we're standing at the bottom of the bridge complaining that LASA is not cleaning up the bodies fast enough. I hate to be so graphic, but it really is a lot like that. We kind of know the issues that are making people homeless. That's why we are trying to look at controlling rent, which we have a terrible hard time doing. We are looking at controlling eviction, which we are able to do during the pandemic. Only probably, we'll see. It is people raising the rent as much as they like, no limits, and saying to a family, if you can't make it, get out. And yet, that's one more homeless family. So we're doing what we can on affordable housing, doing what we can on creating more units, doing what we can on master leasing and even buying hotels and motels. But with LASA, I think since they are responsible for moving people off the street, this kind of arrangement, I think, will at least help somewhat, having an intergovernmental table to do the work more efficiently. So, and I hope effectively. So I look forward to our continued efforts to improve the homeless services system as always. And thank you very much for letting me co-author and ask for an aye vote.
Thank you. Supervisor Barger, you're recognized.
Thank you, Madam Chair. So I think we can all agree that homelessness continues to be one of the most immediate challenges facing this county. This is evident in our communities where homelessness is on the rise. Housing has become less affordable. Mental health services need to be reformed. And substance abuse cases and deaths associated with overdoses are completely out of control. Today's motion includes collaboration with our partners in the city of Los Angeles, which clearly is an integral part of our efforts. However, I will continue to voice my concern about the fact that we need to advocate for the inclusion of more regional input from our 88 cities and our local councils of government. There's simply not enough local and regional collaboration within the existing governance structure to provide the much needed feedback on funding and services to these communities that exist outside of the boundaries of the city of Los Angeles. When we were looking to pass Measure H, we wanted all of them to support it. Therefore, we made promises that are not being kept. By focusing much of this motion on the city of LA, I truly do not believe that it fosters a spirit of collaboration or a partnered approach with our diverse communities and within our cities. Sadly, we are almost halfway through the lifetime of Measure H, and I believe that the current system and structure that we are using to address the homelessness crisis is simply not working. When I go out and talk to my cities, I have yet to hear one city manager and or elected official outside of the city of LA have anything positive to say about the work that LASA has been doing, even in terms of even getting reimbursement to the nonprofits. There are many, including myself, who believe that this is due to the fundamental failures of LASA's existing structure. This board has previously tried to address the issues within the LASA governance structure in incremental ways. In February of 2020, I authored a motion with Supervisor Solis to revisit LASA's structure and the function. In September of 2020, former Supervisor Billy Thomas and Supervisor Hahn introduced a motion to explore new governance models to improve accountability and oversight of homeless service funds. I appreciate the intent of today's motion and its efforts to examine LASA's governance structure once again. And while the establishment of the proposed intergovernmental committee to assess these issues is a step in the right direction, I believe we need to act with even more urgency than what is prescribed. And I would hope that the development of this committee and the turnaround of their recommendations can happen quickly. We must also be open to analysis and recommendations that explore the complete overhaul of the JPA that established LASA nearly 30 years ago. Never was it envisioned to be a county-wide group to look at the expenditure of homeless funds. And I want to remind my colleagues, this is not just a request, this is a matter of life and death. Just this year, from January to July, the coroner's data shows that 739 unhoused individuals tragically passed away while living on our streets. Even more concerning is that this represents a 20% increase compared to the 616 unhoused individuals who died during the same time frame last year. I'm not blaming LAHSA, but the accountability starts with this board. I believe it is broken, and I believe that we need to seriously consider the structure of this agency. We provided them with an infuse of funding. They grew rapidly. They have a lot of employees. And while I agree with you, Supervisor Mitchell, that they can't fix it alone, they should be recognizing their deficiencies and looking at what they can do better outside the city of LA, which to date they have not done. So I would urge my colleagues to be mindful of these devastating consequences related to the deaths that are currently happening on our streets and explore solutions with a sense of urgency. The passage of previous motions shows that this board has been willing to act with urgency when needed. I'd ask my colleagues to think about whether this motion will move us any closer toward the goal of housing the unhoused, providing much needed wraparound services, supportive and mental health services, and implementing a homeless service delivery system that delivers measurable outcomes. And lastly, I'll just say that the homeless crisis is a challenge facing us all, not just the city of LA. It's going to take an intentional, partnered approach toward identifying solutions and working on programs and the services that help prevent homelessness. I want to personally say I am grateful to our many cities, service providers, and community partners who have joined with the county in our efforts to end this crisis. And they have expressed their concerns in writing, in particular the San Gabriel Valley COG, who sent a letter to all of us, providing specifics in terms of what their concerns are. And if we turn our back on them, if we are going to seek an extension on Measure H, I will guarantee you that 87 cities are going to question whether or not they want to be a part of that arrangement. And I think you will have many that will say no, thank you. Thank you, Madam Chair.
Thank you very much, Supervisor Barger. I want to also make a statement and know that this is, yes, a very important item before us. And I had the opportunity to meet with the individuals that came up with this report. And I believe talked to different members on the 8th floor, so to speak, about the need to try to provide a different model of governance. And one of my questions to them was that there had to be room for our COGs, for the cities that we represent beyond just the city of LA. And while I represent the city of LA, I don't represent all of it, but I do represent 23 other cities, along with that 24 other unincorporated areas in the county. And I'm constantly reminded by people in my district outside of the city that they recall that we went out and told them that we were going to extend homeless services to them, and therefore we needed their support on Measure H. Many of them went out of their way. We had to beg, borrow, and just really do a lot of outreach to many of our cities. And there was this, I believe, that they too would be able to reap the benefits of Measure H. And what we found, unfortunately, is that LAHSA and the way the formulas were identified and the makeup of the different governing members didn't really extend beyond certain, how could I say, areas. And I think that Supervisor Barker, you hit it right on the nose when you said that we did work together to try to increase funding for our COGs. In fact, $5 million that we made available to our COG in the San Gabriel Valley. I too received a letter from them. I represent the San Gabriel COG as well as you, as well as Supervisor Hahn, and I respect the work that some of our cities have been doing. It took a lot for us to see communities like El Monte, Baldwin Park, Monterey Park, and other parts of the county that actually stood up and worked with us because we extended an olive branch and did what we could, standing up Room Key and now Home Key. and bringing support services that we saw flourish here in downtown area out to the San Gabriel Valley, like Shower of Hope, and even services for laundry, taking out those services all the way to the San Gabriel watershed and the canyon, and working very hard and diligently with many providers out there that don't get sufficient funding, or some that did engage with LAHSA, but also had qualms because they were not appropriately paid when their contract was due. Payment could really undermine many of these very fragile CBOs that provide essential services for many hundreds and hundreds of residents in not just the San Gabriel Valley, but in Southeast LA and other parts of the district that I represent. So I am, I was hoping that we could have an amendment that would include a seat at the table for a member of the COG to try to provide that intergovernmental body the support they need at the table, not just in as an advisory role, because they have made in many ways a statement by putting funding in from their own cities, from their own community development block grant programs, and some have made it an effort to even hire up people, navigators working with us. I know it's not enough. There has to be more. But if we don't change the governance so that it really is reflective of the entire county, then I don't think we're adding anything new here. So that's where I'm coming from. That's all I have to say. Thank you. Any other members wishing to be recognized?
Yes, Madam Chair, if no one else, I'd like to add on for a minute. I have a question.
Go
Sorry,
ahead.
Hilda, are you there?
Yeah, I'm here.
Okay. You said you had wanted to add COGS to this, but you didn't say that was an amendment. Forgive me if I'm, out of the loop here, but there's lots of loops, as you know. And
Well, I was told that if I presented an amendment, it would not be accepted by the authors. That's why I'm not presenting anything.
I understand, but
Ooh.
Well, I think it's kind of fun to have these conversations in public. Maybe not. I've always been kind of ambivalent about COGS. Let me give everybody a minute to think about this and how we want to kind of work our way through it. I think it is important for us to kind of take a breath and figure out, never mind the process and whether we agree with every minute of it, but what is it exactly we want to do? I've never really felt supportive of many of your, not your, Madam Chair, but everybody, all my colleagues' critiques of LAHSA, because it's kind of like nobody was dealing with what was adding all these homeless people. They were only saying LAHSA wasn't doing it right, wasn't doing enough. And, cities say, I want more of the pie. Well, how come I'm not getting more of the pie? Some COGS are great. Some COGS are completely useless. So I've always been kind of ambivalent about it. And frankly, just changing who's on the board or whatever, it doesn't actually get to the root problem. What cities are contributing to keeping people out of homelessness? Most of them don't even have rent control ordinances or anything that helps. So I guess if we can, create a structure that satisfies all five of us, then fine. I have no objection to adding representatives of, the entire group of COGS, one or two or whatever, if that was the amendment. But I think it is important to join into this effort and not just kind of let it fall apart and keep throwing brickbats at LAHSA. So I'm not quite sure because I'm not privy if there's been a flurry of texts, but I was hoping we could work something out here. And often we don't do it in real time, but maybe this time we can. So you wanted to propose adding two representatives, or what was the amendment?
If I could clarify in terms of what the motion does include, because I heard from the chair loud and clear And we did make an amendment to the motion to include the COGS in an advisory role. But if I could just go on to say, it's not that I don't support the COGS, I have. In fact, when the COGS and the cities lobbied Sacramento for more money and the counties were not supportive of the COGS getting more dollars, as chair of Senate Budget, I stood in the gap and protected COGS. And so I don't want to give the impression that I don't support COGS. But I'm also clear about the way LASA has been bashed. And I'm also clear about if we're trying to get to a point of a governing entity that can be held accountable, that we are clear about who should be at the table. The advisory capacity could be more expansive. But and there's no rule that says that there can't be additional joint powers authorities. What defines the joint powers authority is who contributes financially. And so I want to be clear that it's not that I'm anti-COG at all. I am working very hard collaboratively to create a framework by which we can hear a report back, to narrow the focus and scope, to clearly define who should be at the table. And I think it's the city of LA and the counties that are taking the brunt of the media and public hit about what these two levels of government are doing to improve the plight of our unhoused shared constituents. Again, nothing in this motion would prevent additional joint powers authorities, and it's a report back. And again, the COGS were included in an advisory role. They are not currently included in the JPA that created LASA either.
I understand, and I think it's a very good point. The governing body of any JPA should be those who are members of participants and partners in the JPA. So, as I understand it, Supervisor Mitchell, you would welcome the participation of the many COGs in an advisory position, but do not consider it appropriate that they govern an entity to which they do not contribute.
That is correct, and that amendment is currently, in the motion before us, that they could be a part of it, they could serve in an advisory role. Absolutely.
And my understanding then is that others of my colleagues want them to, despite the fact that they don't contribute directly to this particular entity, to LASA, to be on a governing body. But it's a report back about whether, well, I don't think a report back would say whether they thought it was appropriate or not. So it's kind of hard to figure out what the report back would say about the COGS. So I think I agree that it's more appropriate to have them in an advisory capacity, and that would, and to try to build in the ability that their feedback be considered, because it's not just about one city or another. We've all got cities in our district and COGS, and they are very different from each other. So I would like to see there be some kind of intergovernmental entity like this. And I assume that if the motion doesn't pass, LASA just stays the same, which doesn't sound to me like what everybody wants either. And also, changing governance of body and thinking that's going to solve the problem is like, I hate to say it, moving deck chairs on the Titanic. It is not the thing that's needed. What's needed is prevention, real prevention. And I don't see any of it here.
I completely agree with you, Supervisor Kuehl. I think in my opening remarks, I talked about the fact that we point the finger at LASA and fail to acknowledge all of the policies, some of which brought to bear by government that have contributed to the current moral crisis that we're facing. I agree. This is in response to a desire that I heard from both city leadership and county leadership, where we come together and step up to the plate in a meaningful way to try to improve this one element. Again, in hearing from board offices, we included the COGS in an advisory role. Again, to clarify, I too represent COGS and have fought for them to get resources to the table, even during the times when the counties didn't support that. And so I don't want to give the impression that I don't support the COGS, because that is not the case. And again, in response to board office desires, we included them in an advisory capacity. But again, if we want to, redefine or reimagine how LAHSA can truly be a more effective entity, the JPA was established in 1993 with contributing members. We started there to narrow who is at the table and really try to help identify and define ultimate accountability to LAHSA's success. That is the spirit in which the motion was brought forward. And with that, I ask for an aye vote.
Well, let me say I would encourage my colleagues to support this, since it's only a report back, because it of course gives everybody the ability to bring their own motions later, to amend later, and maybe we can, work through so that it works.
Madam Chair, I'd also like to speak.
I was waiting too.
Okay. Sheila, are you done? I can recognize the other two members that haven't spoken. So
I would be so happy to hear from the fourth and the fifth.
Supervisor Hahn. Thank you. Supervisor Hahn.
Oh, yeah, thank you, Madam Chair. I really was listening to this debate, and the point that really did resonate with me, Supervisor Kuehl, was the reference to the Titanic, because that is a little bit what I'm feeling about sort of everything we've done since Measure H was passed in regards to LAHSA. And, even talking about the COGS, I mean, in that same reference, Sheila, you're like, okay, as an advisory group, do you guys want to be on the promenade deck, or do you want to be on the main deck as the ship goes down? I mean, this is how I'm feeling a little bit, colleagues, today, is that I totally, Supervisor Mitchell, I totally understand what you're trying to do. I feel the same anxiousness and frustration that I hear in your voice, and particularly since you've talked to other board offices. I am frustrated beyond belief about, and I'll say it, about LAHSA. I have been one of those that have criticized it, and I know, Sheila, you have pushed back on me a little bit on that over the last few years since I've been a supervisor. But just in the past 5 years, colleagues, we have passed over 200 motions, specifically on the topic of this homeless crisis. I'm at the point, literally, that I don't see anything in this that will actually solve this problem, will house more unhoused, will get to the root problems. I am not convinced that creating another intergovernmental body made up of elected officials from the city and the county, does anything to move this forward. We're already accountable. I got news for you. I am accountable. When people want to talk about homeless, they're going to point their fingers at us because we convinced the voters to give us their money. We convinced them to pay a quarter-cent sales tax on everything they buy, give it to us, and then we'll work with LAHSA to try and solve this problem. We came up with 47 strategies to do this. I respect our attempt to visit LAHSA's organizational structure, but I honestly don't think I can vote for another motion that talks about this, because it just is not getting to what is wrong about our approach. One of the things I'd like to see is our CEO and maybe our new interim director of homelessness, Cherie, go back over all our over 200 I think it's 237 motions that we have passed about this homeless crisis. Go back over them. What were they? What worked? What didn't work? And bring back to us something a little more substantive about what direction we should go in. And the other thing, I just wanted clarification. You keep talking about this being a report back. I look at the first directive as establishing a standing intergovernmental body comprised of elected officials from both the county and the city. And again, I don't know enough about what that would look like. Is this another, do we meet regularly? Is it Brown acted? Do we take public comment? How does that group of elected officials weigh in with our appointees on LAHSA? There's too many questions, Sheila and Holly, for me personally, to support this today. I wouldn't mind, looking at something a little more concrete and understanding how more elected officials thrown into the mix is going to solve this problem. But at this point, I just don't see it. And I, just don't think I can support this today. But, we have meetings all the time. We can motion more stuff. I just am frustrated because I don't think anything we're doing yet is actually fixing this problem. Thank you, Madam Chair.
Supervisor Barker?
Thank you, Madam Chair. Well, first of all, I have to say, and I can only speak for myself, on the San Gabriel Valley COG has been probably one of the most open and useful groups that I've worked with as it relates to homelessness, to the point of where they spearheaded us getting money into the cities, because they all have the knowledge of what they need to do in their cities and have been very responsive. So the San Gabriel Valley COG has been an incredible partner, especially when we're dealing with the homeless issue. And, I think that an example, Supervisor Solis, is with Azusa and Duarte working to try to clean out the riverbeds, which, oh, by the way, when we put together that proposal and the cities went forward, they were told by LAHSA that they didn't have any vouchers or rooms available when they were going in to clean out the riverbeds. But having said that, you're absolutely right. I'm not going to blame LAHSA for not getting rid of the homeless issue, because the reality is the buck stops with us as elected. But what I will tell you is that when I look at the number of motions that we brought in, we have tried to support. We've thrown money at the situation to no avail. I feel that moving forward with something that's literally putting a Band-Aid on something that, quite frankly, I think needs to go in for major surgery is a disservice, not only to our cities, but also to the homeless population as a whole. I think we have an opportunity. When I look at the JPA was specifically created for the city of LA and the county of Los Angeles because of a lawsuit. It was never envisioned to be a county-wide mechanism to allocate homeless services dollars. And so I think this is an opportunity for us as a board to be leaders and really take a look at the fact that we have an opportunity to really reanalyze. Oh, and by the way, the city of LA, city council feels the same way. And, I think the irony is that I think the city mayor has the ability to appoint on LAHSA, and the city council, I think, at least from my understanding, has expressed some concerns as well. So why wouldn't we use this as an opportunity for us to get together with our cities, of which LA City, the biggest, but also only one of 88, and really look at how we can, as a board, represent the county of Los Angeles and be the peacemaker, bringing together all parties to really address this issue. So I cannot vote for this motion based on the concerns that I have, and I hope that we'll view this discussion as an opportunity to really take a step back and figure out how we can, as a board, lead the region with a solution that is not going to cure homelessness, but is going to at least provide a roadmap moving forward, including our cities, who are really at the front and center of the homeless issue in each one of their boundaries. Thank you, Madam Chair.
Thank you, Supervisor
Madam Chair, if I could just add one more comment and then I'll be done.
Sure.
Thank you. I appreciate this hearty debate. This is what I have been missing, having onboarded during COVID when don't have the opportunity to really convene in person. So I think this is an important element to the creation of public policy. It really is. You know, I too, Supervisor Hahn, would love to be able to review the 200 plus motions that the board has passed on this issue. I, as a new board member, that would be important for me to review actions the board has taken. But I have to say, I don't think it's fair that we continue to say that, you know, quote, we've done nothing. It is a huge challenge. I will be the first to admit that. But actions this board and the city council and other cities and COGS have taken really have created a situation where we're housing 200 plus a day. The challenge is we're 200 plus a day. New Angelinos find themselves unhoused. And so I am clear that this is not a comprehensive solution. No one action by this board could be. We have systemic issues that contribute to the reasons why people find themselves unhoused every day. And so one motion is not going to solve for all of that. We have to build housing. We have to build more affordable housing. We have to expand access to mental health services and treatment beds and drug treatment services and domestic violence shelters. We have to make sure that people are earning a livable wage so they can afford to make LA County home. We have to make sure that the vouchers we do receive, Section 8 and others, are actually, acknowledged and accepted by landlords. We are working and have been successful in securing more vouchers from the federal government. All of those things will help contribute to those 200 people every day being able to stay housed where they are. Madam Chair, I was invited, I believe by you, to participate in this meeting with City Council leadership and heard loud and clear this desire for the two levels of government to work collaboratively. We asked the CEO and CAO of the city and the county to come together and talk about resources and who brings what to the table. So this motion was in that vein, in an effort to make sure that those two entities are prepared in a meaningful way to talk about solutions we can bring to the table. You know, let me be clear with regard to Measure H. A huge chunk of the Measure H dollars go to rapid rehousing and go to people in all 88 cities. And without that, the COGS would not be able to house them. And so I don't want to pretend as if the COGS don't play a valuable role and aren't valuable. The issue here is an effort to try to figure out what we can do to make LAHSA more relevant and function better, given its limited role within the Joint Powers Authority, to be more efficient and effective and clear about our expectations of them, as opposed to continuing to point to them and say they have failed us by not solving the homeless problem. So I appreciate there have been north of 200 other motions. I don't know what all of them are. This motion certainly won't put us back in our effort to come up with a strategic, collaborative approach to helping reduce the number of unhoused in LA County. This alone won't do it. We have to address the myriad of issues that everyone has referenced. This is but one step to talk about and amplify the role the city and county can play more closely aligned in a collaborative way to bring our individual resources to the table to assist those in need. That's the goal of the motion. Thank you.
We've heard everyone then. Maybe we can just call for the question and have a vote on this, okay? So why don't we go ahead and call the roll on this item 27, moved by Supervisor Mitchell, seconded by Supervisor Kuehl, to approve the item. Madam Executive Officer, please call the roll.
Item 27 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
I'm going to abstain.
Supervisor Hahn abstains. Supervisor Barger.
I'm going to abstain.
Supervisor Barger abstains. Supervisor Solis.
Abstain.
Supervisor Solis abstains. 2-0 with 3 abstentions. Motion fails to pass.
Thank you.
Thank you, Madam Chair.
Hey, members, let's move on now to item number 29, toward a colorblind child welfare system pilot program for safeguarding against racial bias, which was held by Supervisor Mitchell. Please begin, Supervisor Mitchell.
Thank you, Madam Chair. I'd like to start by thanking UCLA's Pritzker Center for their work on this project, as well as the Children's Law Center of California for their advocacy at the state level on this important piece of legislation. When I left nonprofit executive management and ran for public office, I was clear that the reason I did that, my intention was to really seek bold transformational change of our systems, particularly systems that criminalize poverty, that were steeped in bias, and those that are rooted in institutional racism. Because in this instance, colleagues, for decades, Black and brown children have been substantially overrepresented in LA County's child welfare system, and it's past time for us to change that. And so I'm really proud this afternoon to introduce a motion that I believe will serve as a tool to help us dismantle that bias. Blind removal is a child welfare practice which centers a removal decision on the facts of the case, rather than a family's race, ethnicity, or neighborhood in which they live. Removing a child from a home can create irreversible damage if the removal is proven to be unwarranted. In piloting blind removals, I am hopeful that the research will teach us about the role implicit bias can play in those decisions. And we should all be clear and honest. We know that every human being has bias in our systems, no matter who we are or our life experiences. And so I think that this pilot gives us the chance to achieve meaningful systemic change in one of our county's most important functions, protecting the most vulnerable among us, our kids. It occurred to me recently that a number of other systems, we guard against the impact of racial bias, most notably in our employment systems, when we consider race as a protected class. So surely in the nation's largest child welfare system, we must employ the same kind of protections to benefit children and their families. This pilot and this whole conversation may be uncomfortable for some. However, from my perspective, the data compels us to seek out every practice that will help us guard against bias and ultimately the overrepresentation of children of color in our child welfare system. In achieving fundamental change, we have to do what we've never done before to achieve results we've never experienced. So I encourage your I vote, and with hope, we look forward to the results of this research study. Thank you, Madam Chair.
Supervisor Sheila Kuehl, you recognize.
Thank you very much, Madam Chair. You know, I don't know whether we've all had experience with these kinds of sort of blind studies, but I did when I was at UCLA, and I want to say it's a real thing. I mean, people are not aware, honestly not aware of their biases. And when there were tenure considerations, it was really about gender when I was at UCLA, of course, but it was, if you did not identify the gender of someone who wrote a paper or, had proposed some kind of new program, it was much more positively received than if the gender of the writer was identified as female. And the study shocked a whole lot of people, not me, of course, but a whole lot of people. And so I think it is really important to do this to really understand how unconscious bias may sort of disproportionately impact our communities of color. No question about it. I'm strongly in support of this motion, and I hope others will be as well. Thank you, Madam Chair.
Thank you. Are there any other members that want to be recognized on this item? Seeing none and hearing no comments, item 29 is before us, moved by Supervisor Mitchell, seconded by Kuehl. To approve the item, Madam Executive Officer, call the roll, please.
Item 29 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barker.
Aye.
Supervisor Barker, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you. We'll now move on to item number 37, fiscal year 2021-22 homeless initiative funding recommendations, which was held by Supervisor Hahn. Supervisor Hahn, you are recognized.
Thank you, Madam Chair. This is 37, right? What a day this has been so far, colleagues. Madam Chair, thank you. This is part of, I think, our frustrations are going to come back up on this item, Measure H funding recommendations. I am frustrated, as I think I've heard my colleagues, sort of at where we're at. And I think one of you mentioned, maybe it was Supervisor Barger, that, this is the 5th year of Measure H funding, marking the halfway point of the lifespan of Measure H. And I think we can all agree that we're not where we had hoped we would be at this point in tackling this crisis. Encampments have grown. Tens of thousands of people are still suffering. And, we got the recent coroner's report about how many are dying on our streets. And we've been pouring money into this problem. And there are so many people who we are still so far away from helping. People are at their wits' ends. And I understand the challenges. I know that plenty of people who are unhoused suffer from very serious mental health challenges that are not easy to treat. I understand that building permanent supportive housing takes years. And I know that even finding a site for shelter that a community will accept can be next to impossible. And I know that we do have many more people becoming homeless. And yes, we're housing more than we've ever housed before, but more and more people are becoming homeless. Yet this past year, we instituted a countywide eviction moratorium, and we invested an unprecedented amount of resources into shelter and housing due to the pandemic. 2020 should have been the year when we saw a dramatic decrease in our homeless population. Yep, that was not the case. And the longer we take to make a real dent in this problem, the more problems we face. I am particularly concerned that more and more cities are moving to enforce their anti-camping laws, and there are more calls to criminalize our homeless. We have an LA City Council member that's trying to withdraw the whole city from the Joint Powers Agreement of LASA. Judge Carter is questioning our response to Skid Row. And our own sheriff is threatening to clear encampments, a strategy that I do not believe gets us any closer to solving this problem. And the longer we take to solve this problem humanely and compassionately, the more likely people are going to turn to inhumane strategies. This year's Measure H budget comes in at over $500 million. That's a lot of money, $500 million. But it doesn't make me feel any more hopeful, because I know all too well that money alone is not going to solve this problem and get people housed, especially if we keep putting our money in the same strategies that have not worked the past 4 years. So before I vote to approve these funding mechanisms, recommendations, Cherie, I was wondering, I know you're available, and Madam Chair, I didn't know if it was okay for me to ask her some questions now, or did you want to?
I think you can. I think
okay,
that's fine. That's
thanks.
Fine.
Cherie, so you're the new interim director of Homeless Initiative. You're basically our head of our homeless department. Tell me, kind of before I approve these, what is the process that you're going to be taking in evaluating these strategies and where money is attached to each of these strategies?
Hi, Supervisor and the Board of Supervisors, and thank you for that question. We are working on the motion to reevaluate the homeless initiative strategy. So far we have engaged some of the core partners, including county departments and COGS and service providers and LASA, just to talk about an approach to reevaluating the strategies. And we've also done a significant review of all of our existing performance data and research and community feedback, including some of our CES refinement reports, as well as looking at prior input that we received from cities through their homeless plans and from the COGS reports, and also from city-focused policy summits. So we're taking all of that, and then our next stage is actually going to be go out and start having a series of meetings and convenings with people. We want to share with them the strategies to date, what they have done, what recommendations have been made already for modifications to them, and the type of feedback that we've already received, and share that with everybody, and then go ahead and incorporate their additional feedback. So we will be having convenings with homeless services providers, with cities and COGS, with people with lived expertise, with our county departments and LASA and other advocates. We'll then be coming back to the deputies to share all of those findings and the initial recommendations to get their input as well. And of course, the offices are encouraged to participate in any of the other convenings. Once we have all of the input, we will be coming back to the Board of Supervisors with those recommendations.
How long do you think that's going to take, Cherie?
Yeah, and so our goal was to do that. Let's see, we're looking at through October. We are trying to get the scheduling of the convenings. And one thing that's very important to me is to provide an opportunity for all stakeholders to participate. So we're trying to leverage existing convenings, but also setting up new ones. And we're also trying to do it at different times of the day, including evenings, to maximize support. And so I do want to be transparent that I think in order to get all of the feedback we want, it might take us a little bit more time to schedule all of those meetings. So it might extend a little bit past October, but our plan would be to give you the preliminary report at the original due date.
Yeah, I appreciate that. And I think I like what you're doing. And again, it seems a little backwards that we're approving Measure H funding recommendations, and then you're going to really begin to do a deep dive into our strategies and whether the right amount of money is attached to the right strategy. Because I do know a couple of years ago, colleagues, we found out clearly that we needed to put more money into prevention because we had more people falling into homelessness. So, you know, I am concerned that we're approving these before, you know, Cherie, you do a deep dive on whether or not we're putting the right amount of money to the right amount of strategy. Do you think, Cherie, I know this is a loaded question, but do you think that you're going to be able to really take a look at this and give us something concrete on how we might get to the core of actually beginning to bring these numbers down on our streets?
I think that we will be able to do that, but I also want to be transparent that I think the challenges that we're facing are much larger than what we will be able to solve with the Measure H budget. We can take our dollars and we can use them in the most efficient way, and we can use them in proven strategies. But ultimately, with the size of homelessness that we have in LA County, and with some of the challenges that we're facing, which all of you have talked about so well today during the meeting, we're going to need additional supports as well. The state has a new budget that has a number of additional supports that will impact the county. In particular, there is some flexible funding that will be very helpful for us to help program into services where we need it the most. There's also some opportunities with CalAIM, which is a reimagining of Medi-Cal that can help pay for some of the services that we need here in LA County as well. In particular, some of the recuperative care and some of the wraparound case management services that support some of our more higher acuity clients. And ultimately, we're going to need support from the federal government as well with investments in federal rental subsidies. One of our biggest challenges here is exiting people out of our homeless system into permanent housing. We have a very large number of interim housing beds that we're operating. We clearly need more because we have people who are unsheltered, but we're operating a very large number of interim housing beds, and we have clients who are staying in them for a long time because they don't have a rental subsidy matched to them so they can exit into permanent housing. So I think that those are going to be important parts of our strategy as well, is to leverage those state and federal resources.
Yeah, thank you. I mean, a lot of people would be surprised to think that $500 million a year, every year, for 10 years is not going to solve the problem, but it is not about money. Colleagues, that's fine. Cherie, thank you for those answers. I'll vote to approve these, but I will say I'm hopeful that we won't be stuck, and maybe it's a chance, I don't know how that would work logistically if we brought this back up after Cherie brings forward her report on each of the strategies and how much money should be attached to them, that we might, mid-year, maybe make some adjustments, because this is a lot of money, and I want to make sure we're attaching the right amount of money to the right strategy if things change, or if Cherie has found something out that maybe her predecessor did not find out. So I'll vote for these today, but I really want us to have the chance to be flexible, Madam Chair, that if we need to make some changes, that we can sort of legally do that. Thank you.
Thank you. And I agree with you. I agree that while we have this budget before us now, as you and I know, funds have to be at least encumbered in a certain way, but it doesn't mean that we can't change them and prioritize. So I agree that we should have perhaps a midterm or a quarter report coming back to tell us if anything new has changed. So maybe that's something that our CEO, as well as Sherry, you can both bring back to the board as part of this item, as kind of a report back. But I want to thank you for holding the item, Supervisor Hahn, because obviously we have all felt our frustrations with how Measure H and LASA and all kinds of things have been happening. It didn't happen the way we thought, and to be honest, we can't always use a cookie cutter approach. I think we've said that many times and many occasions, and I think that's why this particular budget is a little different. I'm finding that in looking at it, that because we knew we may not have had enough money in Measure H to meet all of our strategies, at least we have found $72.3 million in non-Measure H funding to help supplement the total budget. So our CEO and our staff are looking to see how we can augment, because clearly even Measure H doesn't go far enough. That's one thing. The other thing is that we know in this budget, which I'm happy to see, we just had a discussion on this, that $5 million will be allocated to the Council of Governments and Cities in support of efforts to prevent and combat homelessness. And this is a part of a larger $15 million allocation to support cities' homeless initiatives through the end of fiscal year 22-23, which is great. I'm also looking forward to seeing the homeless service system expand its reach through city-led homeless initiatives. Also happy to see that $220,000 will fund a countywide study on women experiencing homelessness. This study will recognize unaccompanied women as a homeless subpopulation in LA County so that we may better understand and address their unique needs. The allocation is timely since we know that women have been, as been stated by many of my colleagues, disproportionately impacted by COVID-19. The study, I believe, will help us build out a stronger system of support and programs to help unaccompanied women find success on their path towards permanent and stable housing. And then lastly, funding has been allocated to help build out faith-based partnerships through our homeless system. And that's something that I know my colleagues and I have been talking about for a long time. Helping people experiencing homelessness is built to their mission, and it's a part of their moral obligation. And I know that for many of our residents and folks that find themselves in homelessness, this is a critical part of the role that faith-based organizations can provide, offering emergency shelter, meals, supporting vaccinations, providing basic needs as clothing, shoes, hygiene items. I've seen it firsthand during the pandemic, and I saw so many of our faith group organizations really step up to the plate. So I know that we have much to do in terms of providing better leadership and governance, but I think that there are some strategies that do work. So I plan on supporting this budget. With that, I want to recognize Supervisor Kuehl and then Supervisor Barker.
Thank you very much, Madam Chair. I just wanted to make sure that as we, I think, appropriately critique some of the aspects of our homeless services programs, that we also not ignore the accomplishments. Because when we use language like, we spent all this money to no avail, or everything keeps getting worse, it makes it sound like all homeless people are fungible, but they're not. I want to remind us that in the last 4 years, we have rehoused over 75,000 individuals and families in interim and permanent housing. And the fact that there are a new 75,000 and more doesn't mean that we failed or that we did not spend our resources appropriately. If you see their faces, and I have, when they're handed a key or when they move into, even a tiny place, to feel safe, to be able to lock a door behind them, to have a roof over their head when it rains, it is significant, and it is not cheap. Remember that Measure H was primarily about services. We are not building with Measure H. That was not a big part of it. And it was important that we give them the kind of support they need to get them off the street, to get them into housing, and to keep them housed. And I would say, honestly, it's been a wild success. So I don't want people to get the impression, especially when they're going to be asked, as my colleagues have said, to re-up on Measure H, that it was useless. I think it's really important for us as a unit to continue to emphasize the fact that there are things forcing people, dropping people, losing people into homelessness, but that probably by the time this comes up again, over 100,000 of them were helped by Measure H. There's just such a magnitude of inflow. And I know that if we hang together and continue to work together on this, help the people that we have tasked to do the work, like Cherie and her entire staff. I think between her and Phasia, I bet on them. And frankly, colleagues, I bet on us. So let's see if we can't hang together, appreciate where we have had some victories, the lives that we probably have saved, and just keep going until we get through this enormous crisis. Thank you, Madam Chair.
Thank you, Supervisor Barger.
Thank you. And I want to thank Phasia for preparing these funding recommendations for the board. And I appreciate the work that you and your entire team have done to get these recommendations ready in a timely manner. I agree with you, Supervisor Kuehl. We have made great strides. And as I've said in the past, I think that in areas that we need to rethink our strategy, we need to be able to pivot. And I think that, with this recommendation, we are looking at issues that we need to really have a better focus on, because we know that homelessness is a dynamic, complex challenge that we as a board must continue to face. Obviously, we're all passionate about it, which is why I think we have some very passionate discussions surrounding this issue. We all know it's not a one-size-fits-all strategy and approach, and it will simply not work and cannot be applied if it's done that way. We must be strategic in examining the needs of every community and its unhoused population, whether these needs are affordable housing, employment opportunity programs. I know something that Supervisor Solis has championed as it relates to WEDACs, mental health services, a passion of mine, or any of those combinations. The various homeless strategies employed must be adaptable and fluid to meet the needs of our county, and the funding priorities we approve should mirror this. Except for a few items, these funding recommendations that have been provided remain largely unchanged for previous years. I understand the very real challenges that COVID-19 has brought to this county, and especially to our departments and service providers working with the homeless. We are still in the recovery process, and some of the fiscal impacts of the pandemic have yet to truly be felt. Therefore, it is my desire to destabilize the flow of services that are currently being funded. It's not my desire to destabilize the flow of services that are currently being funded. However, I want to make sure that we continually analyze and evaluate our homeless service system and the needs of our communities to adjust funding priorities to align with our findings, and hopefully that can be done in real time. Unless we become aware of these changes and make a good, conscious effort to invest our resources accordingly, we are only going to continue to see more of the same on our streets. And what I see on the streets right now is unacceptable, but I do accept, Supervisor Kuehl, the fact that we have made great strides, but I think we've got a long way to go. And I truly, to your analogy about throwing people off a bridge, we need to find out what the root cause is, and it's not simply housing cost. And we need to invest in, I believe, drug treatment beds as well as mental health beds in order to stabilize and support and provide people with hope that they can one day get off the street, live on their own, and hopefully hold a job and grow. So with that, I support today's item, and I appreciate again, Fezia, the job that you and your team, Sharia, you've done to put this together. Thank you, Madam Chair.
Great. Any other members wishing to be recognized on this item? Okay. Hearing no other comments, item 37 is before us, moved by Supervisor Hahn, seconded by me to approve the item. Madam Executive Officer, please call the roll.
Oh, Madam Chair, can I just say, so I think you had a great suggestion about maybe, again, giving us a little bit of flexibility as we approve these. And is that part of this that we'll get maybe a mid-year update if we need to change the numbers?
I think so. I mean, Sherry, are you, and I know Fezia is here on board. Do you want to?
Yes. Thank you, supervisors, and thank you for the discussion on the homeless budget motion. The board letter, it's actually been very helpful and very instructive. Pursuant to Supervisor Hahn's prior motion, where she wants the CEO and the homeless initiative to basically reassess all of the 51 homeless initiative strategies to make sure that, we're not doing things just because we started out that way 5 years ago. And more importantly, to make sure that the strategies are actually what we need at this point in the journey. I believe that report back is coming back in November, and Cherie Todoroff, correct me if I'm wrong. I believe that might be an appropriate time for us to revisit once we present the information to the board, whichever proposed changes the board adopts. I think that would be an appropriate time for us to.
Okay, that would be great. I just want to make sure that that's part of how I'm voting for these recommendations, is knowing that.
Well, it's going to happen apparently through your motion, so that's good. I think we're just getting updated, but I think it fits perfectly in terms of timing. Are you okay with that, Supervisor?
Yeah. Thanks, Madam Chair. Yes.
All right. Okay. So moved by Supervisor Hahn, as noted. We'll get a report. Seconded by Supervisor Solis, myself, to approve the item. Madam Executive Officer, call the roll, please.
Item 37 is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
Aye.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carried 5-0.
Thank you. Now we'll move on to item 78D, reparations for forced sterilization at LAC USC Medical Center, which I held. Members, I know you're painfully aware that our state and our county have a dark history when it comes to forced sterilizations. For the first time, the law was instituted in 1909 to its repeal in 1979. Over 20,000 people were coerced into sterilization in an effort to prevent people with so-called undesirable traits from passing on their genes. This included women and men with mental illness, disabilities, and even people who were sexually promiscuous. And often immigrants, people of color, and poor people were the targets. Unsurprisingly, a disproportionate number of those targeted were Latinx, who were 59% more likely to be sterilized than non-Latinx residents. And unfortunately, those practices occurred right here as well. Between 1968 and 1974, over 240 women were sterilized at the Los Angeles County USC Medical Center. I've often discussed the need to build a more comprehensive and equitable healthcare system, especially in light of the pandemic. However, we can't truly move forward and address systemic issues without fully confronting our most egregious sins of the past, including what happened to these survivors. We heard some stories earlier today during public comment. We took the first step in the process back in 2018 when Supervisor Kuehl and I introduced a motion to issue an official apology to these women. And at LAC-USC, we have commissioned a large-scale work of art, installed, and a plaque on the campus to express the county's sincere apologies to these women and their families. And last year, as we marked the teardown of the Old Women and Children's Hospital to build our restorative care village at LAC-USC, we held a ceremony with the Tongva and other indigenous leaders to bless and cleanse the land, and we formally apologized once more. But we need to do more. The state is beginning to act, as you know, this fiscal year 2021-22, the budget provides $25,000 in reparations to those harmed by the state law. And although this is a significant step for survivors of the practice across the state, it only applies to victims at state-run facilities and does not include county-run facilities like LAC-USC. We have a moral obligation to ensure that these survivors aren't left out of this corrective action plan and that we take necessary steps to make them whole. That's why I'm introducing the motion today. We must use our collective voice as a county and communicate to our governor, our state leaders, that the survivors at LAC-USC be included in next year's budget. But we should not wait on the state to act before we do. That's why the motion also directs the CEO with the Department of Health Services and Community to work to identify these patients and potentially use county funding to provide them with some measure of financial relief. This will by no means make up for the horrible atrocities that were committed against them, but I believe it's a step in the right direction and shows a commitment from the county that we want to turn our words into action. To any survivor out there that may be hearing this today, I want to say once more an apology from us for the terrible experience they went through here at the County of Los Angeles. Please know that we're committed to making this right however we can. And I also want to thank the community for their unwavering advocacy, both locally and statewide, on this matter. I urge my colleagues to vote aye. Are there any members that would like to speak? Would like to speak on this item? Okay, seeing none, then I will call this item up. 78D is before us. I will move, seconded by Supervisor Hahn, to approve the item. Madam Executive Officer, please call the roll.
Item 78D is before you. Supervisor Mitchell.
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl.
Aye.
Supervisor Kuehl, aye. Supervisor Hahn.
And thanks for bringing this up, Supervisor Solis. I vote aye.
Thank you.
Supervisor Hahn, aye. Supervisor Barger.
Aye.
Supervisor Barger, aye. Supervisor Solis.
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Thank you. Thank you, members. At this time, it would be appropriate to hear from supervisors on items not held on the posted agenda to be presented or referred to staff or placed on future agendas. The following order is, we will begin with Supervisor Hahn, and I believe she would like to read in two report back motions to be approved today. Supervisor Hahn.
Yes, thank you, Madam Chair. The first one I wanted to read in is about our Department of Animal Care and Control. Throughout the pandemic, we all spent more time at home, which led to many of the dogs and cats from our care centers finding their forever homes. As we come out of the pandemic, I've heard from some residents that feel like the appointment-based system, which is currently in place, makes it more difficult for them to adopt the dog or cat of their choice. So I therefore move that the Board of Supervisors direct the Department of Animal Care and Control to report back to the board in 15 days about the feasibility of giving the public full access to the care center to view adoptable animals, and on ways to increase adoption rates and ways to decrease the euthanasia of care center animals. That's the first one. The second one, Madam Chair, is about what happened yesterday that created a huge public safety potential issue at our beaches. Yesterday, the Hyperion Reclamation Plant discharged approximately 17 million gallons of untreated sewage off the coast of Dockweiler State Beach. The Department of Public Health posted beach closure signs in the area around Dockweiler, but many beachgoers and local residents were not aware of the closure, and it was not clear which areas of the ocean water were impacted because Public Health released an alert late yesterday evening. The delay in public notification for a sewage release that poses a public health risk is unacceptable, and the notification process must be corrected. That's why today I'm introducing this read-in motion that will improve emergency sewage spill notification protocols. And after I finish reading it, Dr. Davis, I just wanted to ask you some questions because the public, not surprisingly, is very concerned. So on July 11th, 2021, the Hyperion Reclamation Plant discharged approximately 17 million gallons of untreated sewage through the 1 mile outfall into the Santa Monica Bay off the coast of Dockweiler State Beach. Plant crews worked overnight to resolve the issue, and the Los Angeles County Department of Public Health posted beach closure signs in the area around Dockweiler State Beach. However, many beach goers and local residents were not aware of the closure, and it was not clear which areas of the ocean were impacted until health officials issued a news release later in the evening. The Los Angeles County Department of Public Health Environmental Health Division is responsible for monitoring ocean water quality and is charged with taking appropriate action when untreated sewage enters an area where public health may be jeopardized. If beaches become contaminated due to untreated sewage, Public Health's reporting protocol requires the department to immediately post beach closure signs and issue a public advisory explaining the reason for any beach closures. Effective monitoring and public notification of ocean water quality requires open communication and situational awareness of the sewage discharge incident among all coordinating agencies within LA County, as well as the sanitation districts and sewage treatment facilities. During a sewage discharge event where public health may be jeopardized, it is imperative that public health immediately notify the general public of health risks and swiftly coordinate with partner agencies to ensure health protective action is taken. Immediate notification should be defined as 15 minutes from the time that public health is aware of a serious adverse event that poses a public health risk, not hours. With appropriate coordination and communication among agencies within LA County, we can protect the ocean water quality and public health of LA County residents. I therefore move that this Board of Supervisors directs the Chief Executive Officer, in concert with the County Fire Department, Department of Beaches and Harbors, Department of Public Works, Department of Public Health, and in consultation with Los Angeles City Sanitation and Environment, to report back within 7 days on the following. Number one, any and all issues included but not limited to the cause and extent of impacts related to the sewage spill and or discharge that occurred the evening of July 11th off the coast of Dockweiler State Beach. Number two, all necessary steps to protect the health and safety of LA County residents and provide timely public notification of environmental hazards, including but not limited to dissemination of information, signage, and closures. And three, a report back on the corrective action plan that would result in faster response, coordination, reporting, and communication about future sewage discharges that may require timely beach closures to prevent public exposure. That's the motion, colleagues, and that's in 7 days. I want to get a report back on these, but our office has been inundated with calls from worried people. We got a call from a mother whose child was at swim camp in that very area all day yesterday. So Dr. Davis, can you just speak briefly to those who are concerned, if they were in the water around those beaches yesterday, should they be worried about their exposure to the bacteria, and what health advice do you have for them?
Thank you, Supervisor Hahn, and I'm happy to answer these questions. As we look at sewage being discharged, often 1 or 5 miles from shore, the bacteria levels should be significantly diluted by the time it reaches the swim areas. However, we do go through testing to confirm that that's actually the case. If someone was in water that was polluted with sewage, typically they may have sort of stomach-related illness, depending on what they may have been exposed to, which could include nausea, vomiting, stomach ache, diarrhea, headache, or fever. Sometimes they may have an illness that are minor illness related to ear, nose, or throat infection. And if it's something that's more highly polluted, then it could be something more serious. However, in this instance, as far as I know at the moment, the process is to do 2 test results about 24 hours apart in order to confirm that the water is clear in terms of any levels that would be hazardous. And I believe we have an initial result that shows that there isn't any concern at the moment. However, we need a second example in order to confirm that. So the beach will still stay closed.
Okay. Yeah, thank you. And then how will you notify the public that it will be, the beaches are still closed at this point, right? Dockweiler, El Segundo, those are still closed. So how are you going to notify the public once you've got 2 consecutive samples that it is safe to swim in?
There are 2 ways. One, we will do a press release. The other is the signs that are posted that are, closing the areas of concern will be removed as well.
Okay, thank you. Well, it sounds like the initial samples maybe are saying that we don't have high levels of bacteria. I think we kind of are lucky this time, hopefully. We're waiting to get the second sample, but I got to tell you, it was very disturbing that, Department of Public Health did not get a press release out warning until 5 hours later, warning the public. So that's part of what I want to, do better in the future, Dr. Davis, and I know you'll work with us on that. Thank you. Thank you, Madam Chair.
Oh, I'm sorry. Members, did you hear that? I'm sorry. We're taking up these 2 items. They're both report back, so we can take action on them. The first one is a report back on the managed intake and best practices within the DACC care centers. This is moved by Supervisor Hahn, seconded by me. Madam Executive Officer, please call the roll.
Item 79A is before you. Supervisor Mitchell?
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl?
Aye.
Supervisor Kuehl, aye. Supervisor Hahn?
Aye.
Supervisor Hahn, aye. Supervisor Barger?
Aye.
Supervisor Barger, aye. Supervisor Solis?
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Great. The second motion before us is the public notification of sewage discharge, moved by Supervisor Hahn, seconded by Kuehl. Madam Executive Officer, please call the roll.
Item 79B is before you. Supervisor Mitchell?
Aye.
Supervisor Mitchell, aye. Supervisor Kuehl?
Aye.
Supervisor Kuehl, aye. Supervisor Hahn?
Aye.
Supervisor Hahn, aye. Supervisor Barger?
Aye.
Supervisor Barger, aye. Supervisor Solis?
Aye.
Supervisor Solis, aye. Motion carries 5-0.
Great. Thank you, members. At this time, it would be appropriate to hear adjournments, and we'll begin with Supervisor Hahn.
Thank you, Madam Chair. I move that when we adjourn today, we adjourn in the memory of Robert Bob Bush, who was a resident of Palos Verdes Peninsula. He was only 77 when he passed away. Bob was a longtime friend of mine, my family. He was my appointment to the LA County Capital Asset Leasing Corporation Commission. Bob was a founding director and past chair and a 40-year member of the board of Los Angeles County Economic Development Corporation. He received numerous commendations for his work with LAEDC and is one of 4 persons to receive its Lifetime Stewardship Award. He was a member of the Library Foundation's board of directors, where he was dedicated to promoting literacy, lifelong learning in Los Angeles County's diverse communities. For 10 years, from 1969 to 1979, Bob served as a senior deputy to my father and was his press deputy for a while. He also served as President Carter's California press secretary during the 1976 primary election. And before that, Bob was the editor of Plane and Pilot magazine and a journalist for the Los Angeles Herald-Examiner, the United Press International, South Bay Daily Breeze, and the Los Angeles Times. Bob is survived by his wonderful wife, Judy, his children, Renee, Melissa, and Howard, 7 grandchildren, 4 great-grandchildren, and he will be deeply missed by so many people in the community, so many people throughout Los Angeles County. It's truly, this is a sad adjournment for me. I also move that when we adjourn today, we adjourn in the memory of Bruce Thompson, who was 61 when he passed away. Bruce was a San Pedro legend. He started teaching and coaching at San Pedro High School in 1998. Under his leadership, the school's cross-country teams won 50 titles and championships. He was named the CIF State Model Coach of the Year in 2017 and was inducted into the San Pedro Athletic Hall of Fame in 2019. He will be deeply missed by his brother Doug and the entire San Pedro community. I also move that when we adjourn today, we adjourn in the memory of Lorraine Dida, who was a resident of Rancho Palos Verdes. She was 90 when she passed away. Lorraine and her husband, Ken, who was a council member for the city of Rancho Palos Verdes for many, many years, moved to the Palos Verdes Peninsula in 1961. Lorraine was very involved in the community. She was a member of the Peninsula Women's Club, St. John Fisher's Prayer Group, and Guild 3. Lorraine loved to needlepoint and sew. She used her skills to make hundreds of blankets for newborns and children with severe illnesses. She's survived by her husband, the Honorable Ken Dida. I know he will miss her. They really were just a couple, and they supported each other throughout their lives and their individual endeavors, and their children, Beverly and Bruce, and 2 granddaughters. I move that when we adjourn today, we adjourn in the memory of Rose Marie Dieter, who is a lifelong resident of San Pedro. She was 91 when she passed away. Rose Marie and her husband, Ray, were fixtures in our community, and she will be missed deeply. She was preceded in death by her husband, Ray. She's survived by her 6 children, 22 grandchildren, and 31 great-grandchildren. I also move that when we adjourn today, we adjourn in memory of Nancy Lee Scognamillo, who was 83 and a resident of San Pedro when she passed away. Devoted mother, community member. She served for many years as a lector and Eucharist minister at both Holy Trinity and Mary Star of the Sea. She's preceded in death by her daughter Andrea and son Mark. She's survived by her husband Rosario, her 5 children, 20 grandchildren, and 7 great-grandchildren. And I also move that when we adjourn today, we adjourn in the memory of Shirley Snow, who was 90 when she passed away, also a resident of San Pedro. Shirley attended the same church that I attend in downtown San Pedro, First Presbyterian Church. She was a woman who served the Lord, her family, her church, her community She was an office administrator for First Pres for 42 years. She had a special gift of listening. She knew every member's name and welcomed with open arms anyone who walked through the church doors. She also served as the church's historian. Shirley was also an active member of San Pedro Junior Women's Club, the Junior Women's Club, and Shoreline Women's Club for over 50 years. In 2006, when I was on the City Council, I presented Shirley with a certificate of commendation for her dedication to her community. She was a talented writer. She wrote and acted in plays, both at church and the San Pedro Junior Women's Club. Shirley was preceded in death by her husband, Bert, and her daughter, Diane. She's survived by her son, Don, 4 grandchildren, and 3 great-grandchildren. Thank you, Madam Chair. Those are my adjournments.
Thank you, Supervisor Hahn. Next, we'll go to Supervisor Barger.
Thank you. I move that when we adjourn today, we do so in memory of retired Lancaster pastor Rexford Furman, who died on June 12th at the age of 77. Rex pastored Bethel Baptist Church in Lancaster for 28 years, and in 1979 opened Bethel Christian School. He then pastored in Everett, Washington for 7 years before traveling globally with his wife, Andrea, as field directors for International Global Mission. Rex and Andrea retired in 2014. Raised in Ithaca, New York, Rex graduated from Baptist Bible College and earned a Master of Divinity degree at Los Angeles Baptist Theological Seminary. Rex is survived by his wife of 53 years, children Dana, John, and Lori, siblings Dana and Margaret, 4 grandchildren, and a great-granddaughter. Also, that we adjourn in memory of Glenn Grade, a longtime resident of Valencia who passed away at the age of 94. He was born and raised in Wisconsin. After high school, he joined the U.S. Navy and worked in the medic program while stationed in Seattle, Washington. After discharge, he brought his parents out west, and they settled in North Hollywood, California. He attended USC on the GI Bill and entered the insurance business, ultimately becoming a partner in his agency. He married Dorothy Brinkmeyer in 1951, and they enjoyed 69 years of marriage together. After living in the San Fernando Valley for 20 years, Glenn relocated his family to the Santa Clarita Valley in 1970, where he and Dorothy resided in the same house in Valencia Hills for 50 years. He served his community for years by volunteering at St. Paul's Church, the Senior Center, the Homeless Shelter, and Kiwanis. Glenn is survived by his 2 sons, Brian and Cameron. Also, we adjourn in memory of former Lancaster Mayor Ellsworth Els Groves, who passed away on June 13th at the age of 87. Els served in the California Highway Patrol from 1958 to 1987. His last post was a commander of the Antelope Valley CHP station until he was forced to retire as a result of a head-on, on-duty collision. In 1986, Els ran for the Lancaster City Council. He remained on the council until 1990, serving as the mayor of Lancaster in 1988. Born in Hinesville, Arkansas, Els grew up in Colorado, Washington, Nevada, Idaho, and California, helping with his family business. In 1951, during the Korean War, Els joined the U.S. Navy with his brother Ernie, and both were assigned to the destroyer USS Chauncey. Els began a law enforcement career in 1955 with the California Department of Corrections, working at California Men's Colony in San Luis Obispo. In 1957, he was accepted into the CHP Academy. With the CHP, Els served in Ventura County, San Francisco, West Los Angeles, Oceanside, and San Diego, before being assigned to lead the Antelope Valley Station. His post-retirement careers included working as a real estate broker and serving as a hearing officer and housing inspector for Los Angeles County. He's survived by his wife, Feline, of 56 years, his children, Barbara, Dan, and Sandy, his brother, Ernest, and 12 grandchildren and numerous great-grandchildren. Also, we adjourn in memory of David Hornberger, a former resident of the San Gabriel Valley who passed away on July 5th. Born and raised in Pennsylvania, he graduated from South Williamsport High School and then served his country in the Air Force during the Korean War in Okinawa, Japan. After his military service, he attended Rutgers University and later completed his MBA at the University of Michigan. David has had a successful career as a banker and business owner in Pennsylvania and Southern California. In 1972, he and his wife moved the family to Southern California to serve on staff with Campus Crusade for Christ. He was instrumental in the rollout of the I Found It campaign in the mid-1970s. After the passing of his beloved wife, Jan, in 2009, David committed the rest of his life to the ministry work, which took him to Australia, Pennsylvania, and Georgia. He was an active member of the Christian Business Men's Connection, Pasadena Kiwanis Club, Grace Community Church in Sun Valley, the Masters College, San Gabriel Union Church, and finally the Church of the Apostles. He leaves behind his 3 children, Barbara, Stephen, and J.D., and 5 grandchildren. Also, Jane Lynch, a longtime resident of Santa Clarita, known affectionately as Janie. She was born and raised in Pennsylvania and moved to California in 1964. She earned her registered nursing degree in 1980 from the College of the Canyons and a Bachelor of Science in Healthcare Management from the University of Laverne. During her 38 years in nursing, she worked at Henry Mayo Newhall Memorial Hospital, where her career spanned from floor nurse to hospital administrator and finally director of patient registration. After leaving Henry Mayo, she continued her career as a nurse case manager and retired in 2015. Janie was passionate about music and was a talented pianist. She took music theory and composition classes at College of the Canyons and composed many songs for her loved ones. Janie is survived by her brothers William and John, her children John, Jean, Phil, and Katie, 3 grandchildren, 6 great-grandchildren, as well as many stepchildren and step-grandchildren. Also, George Murrell, a former clinical professor of restorative dentistry at the University of Southern California School of Dentistry, who passed away on June 19th. George was president of his Chaffee High School class of 1942 and captain of the swimming team. After graduation, he immediately enlisted in the Navy and served from 1943 to 1945 in World War II. He received his Master's in Science and Doctor of Dental Surgery degrees from USC and later opened a dental practice in the South Bay. He held memberships in numerous dental organizations and received many awards in his lifetime, including the H. Gale Atwater Award for Excellence in Operative Dentistry. His expertise took him throughout the United States, Canada, Mexico, Central America, and Europe on lectures. George and his wife of 72 years, Anne Marilee, established a scholarship fund for the USC School of Dentistry. In life, he had some wonderful friends, patients, and colleagues, but most of all, he loved his family. He is survived by his wife, Anne Marilee, his 2 children, Marilee and John, 5 grandchildren, and 5 great-grandchildren. Also, Steve Sorrow, a longtime resident of Santa Clarita. He was born in New York City and moved to California in his youth. He attended Hart High School in Newhall and graduated from Iona College. He served in the U.S. Navy on the USS Sylvania. In civilian life, he had a successful 44-year career in financial sector. Steve was very active in its community, volunteering with Pet Orphans of Southern California, Canyon Theater Guild, Momentum Kung Fu, and Humane Animal Rescue Group, among others. Steve taught Kung Fu and Tai Chi to local youth and financial proficiency to high school students through junior achievement. Steve will also be remembered as a talented performer, whether on the stage with the Canyon Theater Guild or in the ballroom with his wife Toni and the Beverly Hills Formation Dancers. He's survived by his wife Toni, his sister Christine, and his brother David. Also, that we adjourn in memory of Jeannie Howlett Schmidt, who passed away at the age of 96 on June 6. Jeannie was raised in Hollywood and attended Hollywood High School. She married fellow classmate and childhood sweetheart Ben Schmidt in 1947 at the Stanford University Chapel. Always stunning, Jeannie modeled at an early age in print, on runways, and later as a Bullock's Tea Room model. For 30 years, Jeannie was tirelessly joyful and a volunteer in the San Marino schools and loved volunteering for Huntington Memorial Hospital, chairing the Auxiliary Guild luncheon events and elegant galas. A charming, vivacious personality, she was a lover of people and parties and brought joy and delight to every gathering. She's survived by her 3 children, Nancy, Peggy, and John, 6 grandchildren, and 6 great-grandchildren. Also, Barbara Jean Summer, a longtime resident of Valencia. She was born in Chicago and moved first to North Hollywood, then to Valencia in 1973. She worked for years as a teacher's aide at Meadows Elementary School. She was also a certified travel agent. She provided support in many ways to Our Lady of Perpetual Help Catholic Church and will be remembered by countless couples in the Santa Clarita Valley as their wedding coordinator. Barbara survived by her 5 children, Tom, Patty, Rick, Rob, and Jim, 8 grandchildren, and 3 great-grandchildren. And last but certainly not least, I move that we adjourn in memory of Dr. Rita Thomas, a longtime resident of Santa Clarita, who passed away at the age of 67. She was born in Columbus, Mississippi, and was raised in Los Angeles, where she attended Crenshaw High School. She earned her bachelor's degree in psychology and master's degree in special education from the University of Washington. She earned a PhD in instructional technology from the USC in 1998. She spent more than 20 years as a teacher and administrator in grades K through 12 and higher education from Azusa Pacific University, LAUSD, Los Angeles Community College, and Seattle Community College. She joined William Hart High School District in 1994, serving as a program specialist, administrator of special education, assistant principal, and administrator of career development and workforce preparation. She was also an accomplished musician who arranged and produced music for several renowned groups and singers. Rita is survived by her mother, Sarah, her husband of 32 years, Philip, her stepchildren, Philip and Amani, her sister, Constance, her brother, Richard, and 5 grandchildren. Those are my adjournments, Madam Chair.
Very much. I will go next. I move that when we adjourn today, we adjourn in memory of Miriam Casella. Miriam Casella was born on December the 2nd, 1940 in Bogota, Colombia, and died on Tuesday, June the 1st, 2021. She immigrated to the United States in 1961 and lived in the Los Angeles County area the remainder of her life. Miriam was an avid volunteer, including at Salazar Park in our very own East LA. She loved to travel places like Africa, Galapagos Islands, Iceland, and China. She donated her time to many causes, specifically for the disabled community and veterans, disabled orphans in Mexico and at Indian reservations, as well as financially assisting many single mothers and young adults in college. Miriam was a strong proponent of education and a devout Catholic. She was loved by her community and her family. May she rest in peace. Secondly, I move that when we adjourn today, we adjourn in memory of Mikhail Thomas. Mikhail was a very talented musician who unfortunately suffered a heart attack on Saturday, July the 3rd at Rimgrove Park while setting up to play a concert at the Parks After Dark free concert series in my district. Mikhail was a spiritual person who loved everyone and was loved by everyone. He had an incredible smile, but what made him stand out is that he would give you the shirt off his back, and all you had to do was ask. Mikhail was a drummer for over 34 years with the Yolanda Johnson and her all-star band. Mikhail had the pleasure of working with Grammy award-winning groups such as the Commodores, Kool and the Gang, the Supremes, Billy Paul, Roy Ayers, and did many projects with his cousin, Dennis Nelson, serving as assistant musical director under Dennis at both Epic Records and Warner Brothers. Mikhail is survived by his mother, Andretta Thomas, his wife, Leola Thomas, his daughter, Angelisa Thomas, his granddaughter, Morgan Thomas, and his new baby great-grandson, Carson, along with his extensive family that he's grown over the decades. May he rest in peace. Thank you. Next, we'll recognize Supervisor Mitchell.
Thank you very much, Madam Chair. I ask that we adjourn today in memory of Dr. Emma Daniels McFarland. Dr. McFarland passed away this past June 17th at the tender young age of 99. She was born in Camden, Arkansas, where she grew up, and a firm believer and advocate for education. She received her Bachelor of Arts degree in Home Economics from Philander Smith College in Little Rock, Arkansas, in 1950. 2 Masters of Science degrees from the University of Wisconsin-Madison in 1960, and her doctorate in human behavior from U.S. International University in San Diego in 1976. It's at that point she moved to Los Angeles and purchased what she called her dream home in View Park, Windsor Hills, located in my district. Dr. McFarland will be remembered as an expert in the field of urban planning and a trailblazer to improve the quality of life for urban dwellers. She was an active member of the Los Angeles alumni chapter of Delta Sigma Theta Sorority Incorporated. She served as a council aide to City Councilman Gil Lindsay and was also an associate professor of urban planning at the UCLA School of Architecture and Urban Planning. Mayor Bradley recruited Dr. McFarland as a special assistant for human resources during his tenure, where she developed human resources programs for the city. In 1977, she became the first Black woman to head the Western region of the United States Department of Housing and Urban Development, serving under President Jimmy Carter. In 1981, she was appointed to the position of government liaison for the LA Olympic Organizing Committee. Dr. McFarland is preceded in death by her parents, Fred and Bessie Daniels, her brothers, Fred Jr. and Shelton, and her nephew, Reuben. She leaves to cherish her memory numerous nieces and nephews and many beloved grandnieces and grandnephews and other extended family and friends who will all miss her dearly. Thank you.
Thank you, Supervisor Mitchell. Next, we'll recognize Supervisor Kuehl.
Thank you, Madam Chair. I ask that when we adjourn today, we adjourn in memory of Richard Donner, a Hollywood director and producer whose career in film and television spanned 6 decades. Among his notable directing projects were 1978's Superman, 1985's Lady Hawk, and Rutger Hauer and Michelle Pfeiffer, 1988's Scrooge, starring Bill Murray, the Lethal Weapon film franchise, and the 1985 film The Goonies, which we may forget was produced by Steven Spielberg. Donner and his wife, producer Lauren Schuler Donner, produced dozens of films under their Donner's Company production banner, including the X-Men franchise that has spawned a remarkable 13 films over a 2-decade span. He is survived by his wife, Lauren. And I ask that when we adjourn today, we adjourn in memory of Bunny Hertzberg, who died on June 1st. She was so proud of her service as a Red Cross trained candy striper during World War II, a role she repeated in her 60s at UCLA. Raising 5 children in Beverly Hills, she eschewed the country club lifestyle and instead embraced country squire's station wagon duty, building a large circle of friends along the way. Later in life, she decided to pursue a long delayed college experience at LA City College and was very proud of her degree. She's survived by her husband Tony and her 5 sons Lyle, William, Robert, Jerry, and Stephen. And I ask that when we adjourn today, we adjourn in memory of Cordula Polinek, whose career reads like a screenplay. In 1944, she heard the siren call of California. She was hired by 20th Century Fox and stayed at the studio for the next 58 years, the longest tenured employee in studio history. From her first assignment in the screen test department, she moved to the makeup and hairstyling department and later became the head of the wardrobe department, working with such noted costumers as Bill Travilla, the designer of Marilyn Monroe's famous pleated dress in The 7-Year Itch. She held the titles of president and chairman of the board during her 25 years as a volunteer on the board of the 20th Century Fox Federal Credit Union, and she was the first woman to ever hold those titles. And colleagues, I ask that when we adjourn today, we adjourn in memory of Norman Powell, veteran Hollywood producer, director, and network executive. During his 13-year tenure as an executive with CBS Television, he advanced to senior vice president of CBS Entertainment Productions and supervised development and production of more than 80 movies for television and 11 TV series. He channeled a passion for the U.S. Armed Forces, American life, and American history through documentary filmmaking. Norman was most proud to receive a Telly Award for American Valor, an Emmy, and Producers Guild Award nomination for 24, a People's Choice Award for Rescue 911, an Emmy nomination for Washington Behind Closed Doors, Telly Awards for Politics and Warriors and The War on Boys, and a Best Picture award from the GI Film Festival for Brothers at War. He was a longtime member of the Directors Guild of America and an active member of the Caucus for Producers, Writers, and Directors, and the recipient of the Caucus's Distinguished Service Award and Lifetime Achievement Award. He's survived by his wife Ellen and his children Matthew, Sandra, and Scott. And I ask that when we adjourn today, we adjourn in memory of sports agent Thomas Reich, a pioneering baseball agent with an ebullient, oversized personality who helped players gain multi-million dollar salaries in the early years of free agency. In February of 1982, he negotiated the very first contract with a $2 million average salary. He negotiated George Foster's $10.2 million 5-year deal with the Mets. And among his other clients were Jack Clark, Sammy Sosa, Mo Vaughn, and John Wetland, who pitched for the Dodgers. He's survived by his wife PK, his daughter Shannon, and his brother Sam. And I ask that when we adjourn today, we adjourn in memory of Donald Schwartz, a successful financial advisor and portfolio manager with RBC Wealth Management in Beverly Hills, as well as a noted philanthropist. He served on many boards, including the Board of Overseers of the Los Angeles campus of Hebrew Union College, Jewish Institute of Religion, the Board of Governors of the City of Hope Comprehensive Cancer Center, and Vista Del Mar Child and Family Services. Additionally, Don was a former president of the Wilshire Boulevard Temple in Los Angeles, and most recently founded and chaired the Military and Veterans Appreciation Trust Foundation, whose mission it is to support veterans of the U.S. Armed Forces and their families with a focus on post-service career building through the Heroes Linked program. He's survived by his wife Kathleen, his brother Robert, his sons Josh and Andrew, and his stepson Todd. And I ask that when we adjourn today in memory of Joan Seth. Joni loved dancing. She was active in United Synagogue Youth. She moved to LA at the age of 19, was married to Lionel Fishman, and then to Zachary Seth for close to 50 years. Upon moving to LA, Joni became a beloved religious school teacher and administrator at University Synagogue and Temple's Beth Am and Stephen Wise. She's survived by her husband Zachary, her son David, and her brother Niles. Thank you, Madam Chair.
Much to all members. We'll take all the motions as seconded. If there's no objection to a unanimous vote, that will be the action. At this time, members, I will ask the Madam Executive Officer to please read us into closed session.
Thank you, Madam Chair. In accordance with Brown Act requirements, notice is hereby given that the Board of Supervisors will convene in closed session to discuss item CS1, Department Head Performance Evaluation, and item CS2, Conference with Labor Negotiator Kezia Davenport and designated staff as indicated on the posted agenda.
The board is currently in closed session and will return to open session once closed session has ended. board is currently in closed session and will return to open session once closed session has ended. The board is currently in closed session and will return to open session once closed session has ended. The board is currently in closed session and will return to open session once closed session has ended.